Okay, we are now live, so this is if you're a new-time visitor, thank you, and this is a televised meeting, which will be on YouTube tomorrow.
Awesome.
So it is 6:09 PM, and I'd like to call this meeting of the Tewksbury Board of Health to order. It is Thursday, March 21st, 2019. We got a lengthy agenda tonight, so the first three are hopefully be quick approval of minutes from our February 21st, 2019 meeting. Our working group meeting was held before our regular meeting on the 21st, as well as a follow-up special meeting on the 27th. I and the director had both gone through and made edits, and I have just two edits, grammatical, to make on the February 21st working group. First one, I just want to insert the word "and" in front of Anthony Boschetti on the start of the third sentence. And on the very last, on the motion, motion unanimously carried 4-0. There were four of us here. The three came from our meeting on the 27th, where there were three of us. So that's all that I noticed.
I have no corrections or additions, Mr. Chairman.
Mr. Bichetti, any,
I'm fine with that, Chairman.
okay,
I would abstain, I wasn't here.
okay,
Fine with me.
okay. So someone would like to make a motion?
I make a motion that we accept February's minutes as revised.
I'll second it.
Okay. Motion's been put forth and seconded to approve the minutes of February 21st, the working group meeting minutes of February 21st, and the special meeting minutes from February 27th. All those in favor signify by saying aye.
Aye.
Chair votes aye as well. Motion carries unanimously. 4-0, because Mr. Scarano abstained. Okay. Moving on to new business. First, we have Ernesto Gonzalez, if you'd like to come up to the table. Nathan, you're welcome to come up if you need to. And I'll go through the procedure. So for those of you that are first time here coming before the board, there is a sign-up sheet. If you just want to fill that out, and then once you've filled it out, just state the same information into the microphone and make sure you lean into the microphone so it correctly records your voice. Just your name and address, please.
Fill that out too?
Why not? Because if you,
All right, I'll
technically, if
fill
you
it out.
speak at all, then, yeah.
Reason would be permit, right?
Yep.
Okay.
Or, yeah.
So my name is Ernesto Gonzalez. My address is 32 Cross Street, Leominster.
Okay. So, Director?
Good evening. So Mr. Gonzalez submitted his application on February 19th, 2019 for the application for a body art license. He's looking to work at Lucid Arts with Nathan, who's here tonight. He submitted all required documents. Sarah Kinghorn reviewed all the medical pieces, and I believe everything is in order with his medical. He also, just so you know, he submitted his licenses from Leominster, Gardner, state of Florida, and he's also previously owned an establishment as well that I'm sure he'd like to tell you about. So he's met all the minimum criteria for the Town of Tewksbury Board of Health regulations for body art at this time.
And he is here just tonight, as we've asked all new applicants, just to come and meet the board, and there's nothing on the docket for us to approve in this because the director has already passed off in that. So this is more of a
greet.
introduction, meet and greet.
Yeah. So.
Okay. So anything you'd like to say first?
I look
This is very
forward.
informal.
I look forward to work at the shop. I look forward to work here. That's
Okay.
pretty much it, and thanks for your time, definitely. And that, I love tattooing, and I love what I do, and his shop is one of the best shops in Massachusetts, and I'm honestly blessed to have that opportunity to be able to work there. And that, I really don't have anything else to say.
Okay. Any board members have any questions or?
I have a couple, Mr. Chairman.
Yeah, go ahead.
Ernesto Jorge,
How you doing?
nice to meet you. Did you meet the owner, or how did you come to this, Tewksbury?
One of my friends gave me the lead that he was hiring, and I had met him prior to having the shop.
Can I ask what town you live in, or city?
Right now, Leominster.
Okay, so do you plan on moving closer? I know, I'm just asking.
Honestly, I'm not even sure.
Okay, all right, thank you very much, sir. All
Yep.
the best to you.
Thank you.
Congratulations, thank you.
I think if he's passed all the guidelines that we've established for, and we're very familiar with Lucid Arts and Nathan's quality establishment, you're 100% comfortable and familiar with the exposure control plan and all the policies and procedures, Ernesto?
Yes, sir.
Well, as far as I'm concerned, good luck and congratulations.
Thank you very much.
And the only thing I'll add is that we as a board have been working on for a while now, and hope to finish up shortly, updating our body art regulations, realizing that there is no national standard or certifying agency across the U.S. that governs your profession. So we're trying to work proactively with the establishment owners, both establishments in town, to come up with something that sort of elevate what you folks do in terms of making it a bit more strict, but knowing that if the entry standards are high, then anyone that they're hiring's already going to be meeting that. So it'd actually be a marketing thing too for the actual establishment. So that's something that we are still working on. But I guess on behalf of the board, I just welcome you to town and
Thank you very much. I really do appreciate
good
it.
luck.
Thank you.
Let's see, there was one test that you were going to take, 225. Has that been satisfied on the application? It looked like there
Yes,
was
it
one
was.
outstanding test.
Yes, you had taken care of that and submitted it to Sarah and all the documentation, so yes.
That's great. Good luck.
Thank you. Thank you very much.
Thanks.
Awesome. Thank you, guys. Thanks for your time.
Good luck.
Thank you.
Okay. Moving on to the next item of new business, introduction to the Clean Slate Center. I guess, Sarah, did you want to give an introduction on this, since this is,
Well, I can tell you a little bit of the background on how it came to approach Clean Slate. DPH kind of reached out to the public health nurses. We're having a hepatitis A outbreak at the moment. It's moved across the country, and now it's in Massachusetts among the substance abuse and use population. So I reached out to Clean Slate to see if we could assist with any vaccinations preventing hepatitis A among that population. And it's hard to find the population sometimes. So I go to, the detoxes at Tewksbury State Hospital. Transitions is another treatment center. And then I went to Clean Slate, and I knew the manager, Mike, from a previous place that he worked. So it was very easy for me to, get in touch with him, and they're happy to have me. I did some flu vaccines and hepatitis A vaccines, and I'm going to go back and do some next week, and then maybe once a month, and just see if I can catch some of the people that are coming through the clinic. So if you'd like to hear them talk a little bit about what they do, it's an amazing place with an amazing staff. Please come on up. So it's
Yep, so
David
come on up.
Tortorella and Chrissy Naughton. Dr. Tortorella.
so So I'm going to sound like a broken record by the end of tonight, but if you just want to sign it in that sign-in sheet and state your name and address into the microphone for the record, please. And I'll just add, even though this is a televised meeting, and I'm pretty certain that not the entire town population is watching us right now, but once it hits YouTube tomorrow, that's when the viewership starts picking up. So people will definitely be able to watch and hear you in their leisure.
He's trying to make us nervous?
I
Oh,
know.
no.
Chrissy.
So, I'm Dr.
Yes.
David Tortorella. I'm the Center Medical Director at the Clean Slate office. Our office location is 170 Main Street, G6. Introduce herself.
I'm Christina, and I'm a Tewksbury resident, also a nurse practitioner. I work with Dave.
So, I figured a couple of things I want to do. I can give you a brief introduction of kind of who we are and what we do, and
Sure.
I'd love to answer any questions you might have about our program or about addiction medicine in general. So, like I said, I'm Dave Tortorella. I've been working with Clean Slate for about 1.5 years now. I've been doing addiction medicine for about 5 years in Massachusetts. Clean Slate was started in Western Mass, I want to say 10, 11 years ago, I think. It's grown pretty rapidly over the last few years. I think we have 12 in Massachusetts.
I think we have 15 in the
15?
state.
Okay.
This office opened in 2014, the Tewksbury location.
So it's been around a few years. Most of the staff in our office has been there for about 2 years now. So we're kind of a good team that's really gelled. I think that over the last couple of years we've grown a lot. Sorry if I'm not talking on the mic. But so we've grown from about 100 or so patients to, I believe we have about 350 patients now in our office. We serve all the local communities. We're right on the Lowell border, so a good majority of our patients come from Lowell. Over the last year, we've tried to reach out to basically all the local players, but the Casa Esperanza, CSS, the TSS, the Detox, the whole state hospital grounds, we've tried to really bolster that relationship so that when patients go through detox, they have a place where they can land, because a lot of times people will go through detox and be lost to follow-up, and that can be pretty dangerous. So we're trying to do everything we can to make people know that we're in the community and we're here to help and hopefully get people into treatment. We also accept anything from walk-ins to call-ahead patients. We try to get people in ideally within a day, definitely within about 2 days, but oftentimes if someone comes in, we'll do everything we can to get them seen that day, so you don't have to go through an inpatient program to see us. We'll do anything we can to take care of you. Most of what we do is treating opiate addiction. We also treat alcohol use disorder. So we use a couple of medications, primarily buprenorphine, or the brand name Suboxone, and then we do another medication called naltrexone, or the brand name for that would be the Vivitrol injection. So that's kind of a quick overview. I don't know if you want to add, or-
Just because you mentioned walk-ins, it's important to note people do not need to be sober to come in and start treatment. It's a misconception. People think they have to detox out in the community before they come meet us, and that's not true.
We also have, so our office has myself, 2 nurse practitioners, 3 medical assistants, office manager. We also have a licensed alcohol and drug counselor, Beth, who we were hoping to be able to make it today, but she couldn't. She was sick. So it's not just the medical care. We also provide on-site counseling. And a lot of what Beth does is not just the counseling, but more case management. So if someone comes in and they don't have insurance or a place to stay, we're going to work with them. We'll get them to the Mass Health office, try to get them set up either over the phone before they leave or within a day or so. A big issue for any center, but is just transportation. So we try to work on getting PT1 forms set up for people. We have a small program in place where we can try to even pay for cab vouchers for patients if it's, if it's that or miss your appointment. I'd rather just get somebody seen. So Beth really helps to do everything she can to facilitate that and make sure our patients have
Helping people
resources.
earn their GEDs and
Yep.
find jobs. We've written resumes for our patients, so,
Yep.
yeah.
Yeah, we do kind of rotating workshops. So we do group visits. So sometimes we'll do a resume writing workshop. Our most popular one is a knitting workshop, which people love. So people
They
come
do.
and learn to knit, and it's actually nice. It's therapeutic. It gives people something to work through anxiety, but also people sit, have a slice of pizza, learn how to knit, and they talk and kind of get to know the other patients, which is good. I can talk all day long, but do you have any questions for me specifically or anything I can do for you?
So is there any, since mental health issues tend to interweave with alcohol and drug addiction, are there any counselors or services there that sort of help that piece, or are you solely on the abuse side?
We provide addiction medicine treatment, so we don't provide general psychiatric care at Clean Slate. Our counselor is an alcohol and drug counselor, so she's definitely providing the counseling for that. But we don't have on-site psychiatric prescribers. So what we do is we refer people out usually. So we try to develop resources with the community. So like in Lowell, we'll send people to the health center most commonly, or to Bridgewell for psychiatric services. And we have a few local therapists and psychiatrists that we try to refer to. But we, at Clean Slate, we want to focus on the addiction medicine and not become sort of a primary care clinician, because that it can make it more difficult to kind of focus on our treatment.
We consider it part of the treatment plan for our patients, but some of it happens outside of our office.
Okay, no, that makes sense.
How big is your facility?
Square footage-wise, I'm bad at that.
It's big.
It's
We
big.
have
I
empty
mean,
offices.
We have, I want to say we have 8 or 9 offices, exam rooms. So normally we have 3 rooms that are going, plus 1 for my therapist, but I think we have 3 or 4 empty. It used to be
A lab, a conference room. It's a pretty big
I
space.
think it was a family practice office before Clean Slate took it over, so it's a
Yeah,
pretty
it
good
was their
space.
primary care.
We have lots of room to expand for, full-time. Now you're on the record. So we're at the point now where we have Chrissy part-time now, and we're getting close to the time where we're going to need a full-time third provider, and we have room to grow. So I'm hoping that as we grow and grow, we'll be able to bring more clinicians in and take care of as many people as we can.
How many people a day are visiting your center?
It varies on the day, but if there's 3 providers in the office, we'll probably see around 50 to 70 patients. So an average schedule, probably be about 15 to 25 patients per provider.
And as they congregate, they come in, there's a place to go and a
Yep.
place to meet? and-
Yep.
Yeah, so I mean, and this is a national thing for Clean Slate, but one of the things we really pride ourselves on is we call it reducing stigma. So there's a lot of barriers to care, and we try as best we can to make that stigma go away. So our office looks like any other doctor's office. We have a waiting room. You can come in, get a bottle of water, grab some goldfish or some Oreo cookies or whatever we have that day. Today it's animal crackers, I think. And so we have a nice room for patients to sit and wait. We have private rooms if someone needs to, make a phone call for insurance. They can be in, have
We
a
have a children's
privacy
room.
perspective space. Yeah, we've got a kids' room with coloring books and things, so if people can bring their families and their kids can sit, and so that they can have some privacy. So that's a huge thing. I mean, I've worked in other offices in the area, and we really try to differentiate ourselves by, people walk in and they go, "This feels like a doctor's office," and I say, "Yeah, because it is a doctor's office, and that's what we want. We want it to be a nice, welcoming place."
I know that Sarah was talking about the problem that's spreading. Can you tell us a little bit more about what the symptoms are and what the treatments are and how these people can fit into that objective?
Yeah, hepatitis A is, pretty easily spread. It's basically fecal, oral, and you can get it very easily by living with someone who has it. You have symptoms, diarrhea is the main one. Feel free to jump in.
Stomachache, jaundice,
Stomachache,
yellow eyes, fevers, but usually diarrhea, vomiting in the beginning.
You can get vaccinated and to prevent it, but once you get it, you don't usually get it again. So But if you have other contributing factors, hepatitis B or C, it can really make you sick.
Actually why, just to jump in, but is why I was so happy when Sarah contacted us, because as you know, our patients tend to be under-vaccinated and don't have as much access to healthcare as they should. So the Hep A vaccine is part of the normal vaccine series for babies now, but for our older patients, they might not have gotten it. And a good proportion of our patients have hepatitis C, which is spread through blood and is commonly spread through IV drug use. If you have hepatitis C and you catch Hep A, it can be devastating. It can kill you. So to be able to get a very high-risk, vulnerable population access to that vaccine is huge. And not to be dramatic, but it's really a life-saving thing. Because
As well as the testing, because they can go there for testing and determine what exactly their exposures are and what the remedies are right there and then.
Yeah, we do routine testing for all of our new patients, and follow-up labs as needed. We actually started Clean Slate as a whole, but our office started a few months ago doing hepatitis C treatment in our office, which is really a pretty groundbreaking thing to actually have Hep C treatment right there in the office. So my nurse practitioner, who's not here, Nancy Curran, she spearheads that. So if a patient comes in, they're diagnosed with Hep C, we can do all of the other specific labs they need to determine the type and how best to treat them, and then we can actually get the medication approved and started. And Nancy will know the numbers better than me, and she's going to watch it tomorrow and go, "Okay, why don't you do?" But I feel like we have roughly 20 patients, and I think we've been doing it about 3 or 4 months, and we've completed several patients. So we've actually got cures, which is cure is a word that doctors never get to say. So to say that we've had people come through and get cured of Hep C is awesome.
Well, that's great. Thank you for responding to those.
Sorry to toot my own horn, but I'm pretty proud of that.
Chairman? Yes,
I'd like to ask a question.
go right ahead.
So once you engage a patient and they come and they're seeing you and and things are moving along, when they disappear, do you have any process within your group that you go find them? I mean,
Yeah.
I love that question because Clean Slate has recently brought on a recovery specialist who is not working in our Tewksbury office yet. She's working in our Worcester office. So we have nothing more than a phone number here in Tewksbury. But when the recovery specialists enter the program, they are in the community, physically out in the community. She has found people.
When we have reoccurring health issues with people around opiates and whatever, is there some way that that a person like me could call a person like you, and you could get in touch with them even if they're not a patient at the time, or is that something illegal?
Could we contact someone after being given the name? I don't think we could.
No?
I know
I mean, we
we have a
could-
piece of legislation going on that. I don't know if it's passed yet.
I don't know, with the HIPAA rules these days, it's very difficult.
This population is protected by an additional set of
And it's
state laws.
very difficult to
Their
have
privacy
those
is
questions
protected.
answered without a HIPAA specialist.
But they're not our patient, so.
Yeah, once they're your patient, though, you do have
Correct.
not a right, but you have a way by which you can reach out to
Yeah,
those people.
so to break that down, I mean, for any of our patients, it's actually pretty comprehensive. So, we want to do everything we can to keep our patients in treatment because we know that if they're not coming to their appointments and getting medication, then there's a high chance of relapse, and that could be dangerous or deadly. So if a patient is missing an appointment, the first thing we're going to do is we're going to call them right then and there. I mean, before the appointment, we send out text reminders and call all of our patients 1 or 2 days before to say, hey, come on in. If they miss an appointment, they're going to get at least 1 or 2 calls that day. If someone's lost to follow up, so if they don't call back in a day or 2 to reschedule, then we're going to do an outreach call. I mean, I think we're supposed to do 1, but normally we're going to do probably 2 to 5 outreach calls. I mean, basically until we find them.
Do you have any other names associated with the people?
Yeah.
Like family members or good friends that would come in with them and maybe?
Some patients have signed a release of
Yeah.
information so that the husband or the boyfriend or someone else can call on their behalf.
Or you can, what I'm looking for is maybe you could call them, if you can't, directly contact.
And
the
if they're
patient.
listed as an emergency contact, yes, yep.
Release, if
But,
they
yeah,
get a
the-
release, they can call. but
The
yeah.
balance there is balancing, obviously patients' right to their confidentiality and privacy versus our desire to help them. So if they have signed a release that says, yep, you can call my mom, and it's a full release, then we can do that. But if a patient, doesn't want to, obviously we're going to respect their privacy. And like Chrissy was saying, there's HIPAA and then there's 42 CFR, which is a whole different federal regulation. And then the other thing that you had talked about is in terms of referring a patient. So if you were worried, I have a friend, a family member, somebody that I want treatment, you can call us. Normally what we'll do is we'll try to set up an appointment to bring them in and talk. I mean,
We couldn't outright
I don't know
reach out to that stranger to us.
I mean,
Chairman, just to add
Yeah.
that.
Great question.
Are you familiar with Maria Ruggiero?
Yeah.
Yes.
And the Tewksbury Police Department, as we know, they have a very progressive, active role in this fight against opiate. And I had a conversation with the police department, and what would I do if there was someone that we've had concerns about? And she said, absolutely call us. We'd be happy to just reach out and offer resources. And that probably would be you.
Yes.
Yeah.
She's been to our office.
Obviously I can't
So that's good. You
mention
work-
patients or anything like that, but we've had some really great success stories through that connection with Maria.
Good.
I can think of one, I'm sure there's more, but I can think of one patient that she really helped to reconnect with our treatment and honestly was a wonderful outcome. So, and I can't talk about specifics, but that was awesome. And we've developed that relationship both with Tewksbury, also Lowell has a team called the Co-op team, which is a multidisciplinary team where they will, if someone overdoses, that team, which is police, fire, EMT, and I believe a social worker, will go to the home and offer them services. And we work with them, so, I can't start cold calling people myself, but we'll do everything we can to offer and say, hey, here we are, please give us a call. And we have had people through that, we have several people through that program that have come to treatment. So,
The good thing I hear is that you know about all these other programs, because it's, sometimes there's one over here and one over here, and you don't overlap, and that's really good that you're all connected.
It's a big reason why, when we were talking, why I was pretty excited to meet all of you, because I think a lot of times people may not know we're in the community or may not know what we do or maybe have misconceptions about what we do. So,
We have a problem, too.
yeah, I know, right? Yeah. So just to get a little sunlight out there and say, here we are, and how can I work better with Tewksbury or with any of the surrounding communities to improve access to care?
So I think we definitely want to keep the dialogue open, because one of my concerns has been, we have all these islands of resources out there, and there's really no way to connect the dots, especially to those folks that haven't started any treatment process or family members and not knowing, there's no roadmap out there. You can't just Google it and say, this is what you need to do. So you brought a very excellent question, and I think we just need to work collectively and educate people about, there is an important resource here, but how do we get people, and especially those that may not want to be going themselves?
It is a challenge. I mean, someone needs to be ready for treatment. Coercing someone into treatment isn't really effective. But so that's why we just, we're here. We can do anything in our power to help them and at least get people in the door. And oftentimes that's what we'll do is we'll say, just come on in and talk to us. If, I'm not ready for treatment, we'll come on in and talk. And most of the time, we can at least come up with a plan. And I think people realize, all right, this isn't as scary as I thought. And, Chrissy's nice, Packers, and, yeah.
What are the hours of operation of your facility?
So we're open Monday through Friday, basically 9 to 5. On Tuesday, we stay open till 8 o'clock at night, so our patients that are working or coming from farther away can come in. And then on Friday, we close a couple hours earlier, so we're open till 1 o'clock, just because.
I'm assuming you have like a hotline where you said you take walk-ins and everything?
Yeah.
I don't expect you to be open like an emergency room, but you have a hotline that
Yeah,
can
so-
access a provider should an instance come up, or I'm assuming you take juveniles that may have issues that come in with their parents if.
So right now, Clean Slate, our minimum age is 18.
Okay, so you do have a minimum.
So yeah, so so my background's actually in pediatrics, so I'm really excited to stretch that out. we had talked about targeting and opening up a pediatric-specific clinic, and we had started to do some research into that earlier in the year, but we haven't opened that yet. But if that were to happen, it would be probably its own standalone clinic, because right now, outside of Boston, there really isn't a treatment option for teenagers. And personally, that's something I would love to improve.
I mean, it's an issue, so
it is.
You're considering addressing it. And the other thing is, so there are some treatment modalities that you do, basically where you're treating for hepatitis C and some of the other issues there. I'm assuming you have an expedited process to have QHCs and lookalikes and things like that as far as, and even the hospitals, to just, once you get in there, because I think one of the biggest things is as our chairman was saying, is making sure that there's a continuity of services, because many times it starts in one area, but like you are limiting, in which makes sense, the treatment modalities that you have. So you do have some, but sometimes you come up with some other issues, and so people don't get lost in the in the shuffle, for lack of a better term.
I'd say that the most common need is immediate or as soon as possible psychiatric care, which is why we really try to develop those connections. And then, every patient I ever meet, I want to make sure they have a primary care physician for their general health. So we refer a lot of people to Lowell Community Health, which they have their own substance abuse treatment program, which is awesome there. But, we want to cooperate with them, right? There's no sense in putting up walls. I'm happy to send as many patients as I can there to get treatment. And if they want to stay there for their opiate treatment, that's fine, because I'm happy they've got a doctor. But we try to work with them. To answer your question about on-call and stuff, so, and I've got some cards here I'll leave with you, but.
I was going to ask you a
Yeah,
question.
so the number on here, this is our office number, so if you call this and we're open, my manager, Mike, or one of my medical assistants will pick up, so it's a direct line to us, and this is huge for our patients, because they don't have to go through a phone tree like you're calling your insurance company, which I did yesterday. So that's our direct number, and then there's also a national number, which is on the back of these pamphlets. So if you were to call after hours, if one of my patients needed to get in touch with us tonight, they would call, they would get our 24/7 call center, and there's always a physician on call in every state that we're in. So 3 weeks from now, it'll be me, and so if there were a problem, they would talk to one of our nurses or staff, and then the call would get forwarded to me, and I could take care of that 24/7. So if
No, that's great, because one of the populations, I deal with a lot of this stuff in a different area, but also a lot of the population that you deal with have a lot of oral health issues that come in, and there's a lot of problems that sometimes they need to be addressed too. So that's why I asked you, dealing with some of the FQHCs that have the ability to do it, and hospitals don't, but many times,
Yeah.
I mean, it's like a cornucopia of problems that come up that you have to be able to navigate and expedite the process.
we do our best, we take basically any insurance. I mean, the majority of our patients use Mass Health products, which we take all of them. We take, I believe, almost every insurance that you could have in Massachusetts. When Lowell Community Health Center switched over to, was it WellForce?
Yeah.
So, yeah, when they switched over to WellForce, we, as quickly as we could, got on board with WellForce so we could continue that relationship, because the last thing I wanted was for my patients to have to change and not have access to, actually, I don't know if they have dental at the health center yet, but I think they're working on it. But,
They have a
yeah.
facility, I'm very familiar with it.
Okay,
It's not
gotcha.
up and running the way
Yeah.
it should be, but
Yeah.
that addresses issues
But
that go with FQHCs. They have their own issues. Yeah.
I've worked at a few of them, so yeah.
I'm aware of it, yes, but anyway, that's great to know that you folks do that, and it's, good luck.
Thank you very much. I
So
appreciate it.
thank you both for coming tonight. Yeah.
A comment and a question. I got to meet some folks from through the Tewksbury Cares organization, and I'm going to have to get the name from Susan, but my comment was the gentleman that started what I call a one-stop shop down the Cape. When I had ran for selectman, that was one of my top goals. Anyways, I need to get his name, but I was going to ask ours, but Tony asked that question. I'm really glad he did. But today I happen to have a personal matter. I went to the police station, and a neighbor that I used to have, he was on methadone, and I found out he died of an overdose a couple weeks ago in Lowell.
Sorry to hear that.
I'm sorry.
So to me, obviously, this continues, but I would like to ask, because of privacy concerns, I'd like if I could get your number and then possibly have a tour of the facility, not as an investigator, or a worker from the town, from our department, but as a person that in the future wants to try to do my best in public service to help in any way I can.
Yeah,
Thank you, sir.
I'll give you all my contact info now. Tomorrow, I'm sure my office manager will reach out to you. We can set up a lunch meeting.
He
likes-
loves visitors. He
loves
really
visitors
does.
because I
Yeah.
get to order Papagenos, and Mike loves his mac and cheese. That's the first thing he said to me was about Mike and his mac and cheese. But yeah, and anything else you wanted to add, Chrissy? Or
No, I think you covered it.
any other
Well, thank you
questions for us?
Coming before us, and Sarah, thank you for having him come tonight.
Yes, they're
Thank you for
doing
having
amazing
us.
work.
Yeah, thank
Thank
you so
you.
much. It was a
Leave
pleasure
your
to meet you.
information will distribute to all the board members, so thank you very much.
I'll just drop it off with you. Is that okay?
Keep up the good work.
Thank you so much.
Okay. Next item on the agenda or new business is Max Dairy Farm, 1863 Main Street, violation to the Mass Tobacco Regulation regarding smoking in the workplace, in violation to the Mass Food Code 590.000 for failure to comply to the local and state tobacco regulations. So if you'd like to come on up and just sign your name and address in the sign-in sheet and state it into the microphone, please.
Sign my name.
Did you want to come up for this, or?
Don't know. I
Okay.
mean, he's done some of the investigating. So if you have any questions.
I guess we can always come up if we have questions.
Letter he had written, one of them.
So I guess, Director, I'll have you start this off.
He introduces himself.
Yeah, so if you'd like to introduce yourself first.
My name is John Gallant. I own Max Dairy Farm in Tewksbury here.
Okay.
On March 8th, Friday, we received a complaint at the Health Department regarding the presence of smoke inside Max Ice Cream Shop. Because you can be outside or you can also go inside. So that, not that someone saw anyone smoking, but the presence of smoke was there. This has been a repeat violation going back 2009. And Mr. Gallant has been visited several times over the last 2, 3, 4 years. Mr. Beauregard's been there a couple of times to speak with him as our tobacco coordinator. He's here if you have any questions. So last year, he was given basically a final warning that any continued smoking within the premise would end up in a fine and likely a visit here to the Board of Health to discuss any further action that may need to be taken. So in addition to the state tobacco regulations, he's also a food establishment, which means that he's required to comply with the tobacco regulations as part of his food permit. So I also quoted that as well, because the food permit is the most important thing, I would think, in a food establishment. So we also had done an inspection yesterday, which I have a copy for you here, the photographs.
Yes.
And this is what I gave them today. So
I have a question.
So that's the background. As far as, if you have any questions, we can discuss that. So we have the issue of the responding to the complaint of the repeat violations, and then we also have to address the inspection and the repeat food code violations that we've had through the years.
My question is, I was under the assumption that this was a hearing about the smoking violation. I don't know anything about this part of the violation. This was done yesterday, the day before, I wasn't there.
Right, when you came to my office, this gentleman came right to my office as he knew about the inspection, about the tobacco violation. I had told you that I would be down to do a food
Right,
inspection.
but this is a hearing of smoking,
Right, but
not
part
food
of,
violation.
well, part of the food code is compliance with that as well, so.
I understand that.
That's why I did the inspection as well, so that we could address.
And it wouldn't matter anyway, sir, because if there's an outstanding violation that's affecting the public health, we have the immediate duty to abate it or have you abate it. So with respect to having heard any of these this evening, we're going to take them in order. We are going to discuss the smoking on site, but we're also going to discuss anything that requires immediacy that you absolutely address, abate, stop, or correct. So with both of those things, we're well within our jurisdiction to have that discussion.
That's fine, it was just a clarification.
No, it's okay, and I'm just explaining you the jurisdiction of our board.
Okay?
All right.
Mr. Chairman, if I could
Yes.
ask our director, on the smoking issue, how often has this been occurring? Like for a couple of years or?
We have a timeline that Chairman Barry has that our administrative assistant put together based on our records.
Correct.
And I do believe it goes back to 2009, is it around then?
Yep, July 6, 2009.
Right.
So we just pass this down, you can take 4 copies to pass out.
And our goal generally is to educate when we see these problems. So Mr. Beauregard, being our Healthy Communities Tobacco Coordinator, he does do that for us. He would immediately go out and speak with the person. He's not been fined for this offense to
That-
point at this point.
That's my only question, but I do reserve the right to ask questions on the next issue. Thank you.
Who, if anybody, was observed smoking? Was anyone observed smoking?
No, sir.
And was there a determination of who actually was smoking?
Mr. Gallant basically stated he is a smoker, he should quit.
Yes,
You stated that to
definitely.
me. And he's stated that he's generally not there, he's in the building before the store opens. He's not there after the store opens, which would make sense as to why we've never actually visually seen anyone smoking.
So there's an admission that he was actually smoking in the facility?
Correct, yeah.
At the time, yes, I was.
And are there any other smokers?
No. I didn't understand, I guess, the law, that when you're open, there's no smoking. See, I'm there 7 days a week, 365 days a year. I'm open year-round. 5 o'clock in the morning till noontime, and I don't open up. And I'm not there when we open, because the problem I don't want to have is I have a lot of kids working there, girls and boys, and I don't want to get accused of anything with kids. So they work the place and I don't. They call me up once in a while if there's a problem. I only live 5 minutes away from there. I just didn't understand. I guess I didn't know the law enough about no smoking. I'm not, I don't know how to put it. I know it was my fault, but I just didn't really understand the law of 24 hours a day.
Well, we can understand you're a hardworking man, sir. There's no question that you have to put in the hours that you have to put in to operate your business. But you have to understand that, the issue here is that it's hand-to-mouth smoking. And with hand-to-mouth contact, then you touch something else in the facility. And it seems to me that you're doing a lot of the movement of food product as well as some of the operational issues here. And it's the hand-to-mouth contact that passes foodborne illnesses. It's not just because the smoke bothers people. The fact is that these are the regulations, especially hand-to-mouth, that requires hand washing immediately. This is why you can't eat while you're doing food services. This is why you can't smoke while you're doing food services. Understanding the law as it relates to some of these things, it goes right along with your ServSafe certificate. Do you hold a ServSafe certificate?
I do. It expired a month ago, and I just wanted to show you that this afternoon I just took the food service test and passed it, and it's here on my phone. So it's going to be emailed to me.
And Ed, there's at least 4 questions on that test about hand-to-mouth contact, eating, smoking, and that's one of the reasons that you have to keep certified so that this stuff
All right,
doesn't happen.
it's good till 2021.
And obviously, understanding that this violation is repeated. It is not a single instance where, you could come in and say, I didn't understand the law, because the notices, and I'm not sure how many notices, but there's several here that would indicate that this is a repeated problem. And
Right, smoke in the building.
of course, and there's multiple, every time there's a problem, there's multiple chances of exposure to the public. How many ice creams do you serve a day, average? Average,
Average?
yeah.
God, maybe 300.
Okay, well, there's 300 instances of a possible foodborne transfer, and that's too much risk. No one can put the public at risk like that. We can't allow it, and it needs to be abated immediately. That's why you're here this evening.
Right.
Because there's been so many warnings that now we're at a position where we have to look at penalties, not warnings, not letters, not final warnings. We're in a position under the statute that if we don't act, the state could come in and act. That's where you are on this thing. So I just want you to understand
I know.
that, you're at a threshold here where the local authority can take action and probably should consider it. But remember, where we don't enforce these regulations, we can give one too many warnings, the state can come in and do that. So I just wanted to make that clear that not understanding the law, not knowing the law is not going to fly with repeated offenses. Okay?
I understand. I apologize, and I'll take my medicine, really.
I would like,
He's not serving 300 ice creams.
Can't speak, only people.
That's my daughter, I'm sorry.
It's okay, you can step up and sign in if you'd like to speak on his behalf, and that's not a problem. So just introduce yourself and your name and address after you write it down there, and then you can go through the chairman.
Okay, sorry about that. My name's Susan Matherin. I'm John's daughter. I was just saying, he is there like 5 in the morning to noon. He's typically not serving ice cream, but of course, the cross-contamination or whatever. But that's all the point that I was saying. He's not serving.
Do you serve safe? Do you work over there at all?
No.
No? Okay.
excuse me.
She was just here for
No, I understand.
public support, I guess.
I love my father, too.
What's that?
I love my father, too. Glad you're here.
I would like to say, as a member of the board, that we're a very sympathetic board. You seem like a very nice man, sir, and the majority of the board members here have their own businesses and are regulated in one fashion or another by some type of regulations that are really strict, without going into all the details. So I don't think you're going to find a more sympathetic board that is understanding of the trials and tribulations, the agony, the ecstasy of owning a business. As Mr. Scarano had said, we have to protect the public health. That's our mandate. And if we don't do it, the state can come in, and we care about the community like you do. You live in the community, you have a business there that I myself have frequented, and it's a great product, and probably spent lots of money there over the years too. But on the other side of the coin, when you run any kind of business now, if you don't know the laws, and there's repeated instances, and we're adults, we're not talking with young children, we're not talking with, so I'm like with the baseball, first time, shame on me, say it, second time. So, and we're not here to pass moral judgment on people's needs and desires. I do understand smoking is a very difficult thing to give up, having family members, and whether I believe in it or not, or, totally disregarding the health situation. I know it's a very hard habit to give up, but unfortunately, we do have to protect the public's health. So, as I said, I think that we're going to have to come to some understanding tonight that is probably going to be a final understanding, as far as I'm concerned, for where we are and where you are, because, like I said, it seems like you have acknowledged the issues, and we just need to, we don't want to go what was in the past. We want to go, how can we mitigate this once and for all so that it allows you to maintain your business, because it's gotten to the point that we're really left with no choices. And I hate to bring this up, what's happened when things have neglected, and this is all public knowledge, okay? So I'm not giving up anything. We know what happened in North Reading a while back.
I used to work there
Yeah.
20 years ago.
Yeah. Well,
That's how I got in the food business.
Familiar with it, and I believe that they were warned as well, but sooner or later, something happens. We just don't want the public to be jeopardized in any way.
I agree.
So I'm going to defer to our agent right now and and our chairman, and we'll see what can be done to mitigate this once and for all, because I would say that from what I've seen from the past offenses, this isn't something that you're unfamiliar with. And I hope if you don't know the laws of the business you're in, then maybe it's time to not be in the business, because ignorance of the law, as they say, is no excuse.
There's no excuse. I just want to, what we're coming up with has to do with the smoking right now, right? That's all I want to know, because I still want to make a statement later on. Thank you.
John, how long have you had Max Dairy Farm?
1983.
Okay. You know you're not supposed to smoke in that place, and because I know you.
I know, I
And
can...
You know, but
I
you've
can-
known for a long time, and you're just saying the hell with it, and you're going to smoke because you own the building. And I know you, but you can't do that. There's food in there, and
It's
the
patrons.
people that are in this town now aren't the same people that were in here in 1983. Believe me, I've been here since 1953. My father's been here since 1928. They're not the same people. And believe it or not, we're trying to protect you. We're trying to help you as well as the public. So don't take this personally, other than you
No, I don't.
got to stop smoking in the place.
All right, I have to
Period.
anyhow.
right.
I have to anyhow. I have COPD, and
Thank
I got asthma. And you can hear it in my voice.
So,
Yeah, you got to stop for more than one reason, okay?
so
Exactly.
I'd like to have us put on pause the smoking violation discussion, because the other part's going to be part and parcel to it. Because I'd like us to have discussion led by the director first about the food inspection report, and then I'd like to talk about what I think one of our options might be that relates with the tobacco violation as well.
Mr. Chairman, I only have one question for the director. On the inspection in the bathroom, is there a place to dry their hands? Because in the pictures, I couldn't see it.
I believe there is probably paper towels.
I have paper towels on a dispenser.
Okay, thank you very much. My comment after that is, like I said last night at the candidates, meet the candidates night, the biggest employer is Market Basket, and the smallest employer, I don't have the name, and there's 17 people in our town that are millionaires, and the poorest person, they voted me in to take this position. So the thing is, I treat everybody with respect and dignity, but I do expect, whether it's the millionaire or the poorest person in the town, to abide by the regulations. I'm not happy with this situation.
And let's try to hold our comments to the issue at hand and not about re-election campaigns.
It isn't a re-election campaign. It's exactly what I said last night. I treat everybody with respect and dignity. If you don't want me to say it was last night, then I'll just say I said it today.
And the same goes for the chairman, George.
Okay, so you want to move on from the, I guess I had one final comment about the tobacco is, yes, it is about the food code, but it also is workplace safety and the children that do work there, the secondhand smoke and the smoke that remains in that building is a risk to them as well. So that was my concern, in addition to the other. So just wanted to say that. As you know, we work with our food establishments every year. You know, when we do our inspections, we write down violations, and sometimes premises decay through the years. We're cognizant of the time and money it takes to repair things. So when we write our reports, sometimes there are things that we will say, need to do now. Generally, they're immediate food safety issues that could cause illness at that time. And other ones, floors, walls, and ceilings, we say generally, okay, you've got some time to do that. And usually we would expect one cycle, possibly to get that done. And we give lots of recommendations too. So that being said, since I've only been here 3 years, I've probably been in your place maybe 3 times. Probably 3 times. The premises itself, and that's why I showed you the photographs, and I put 2 sets out here so you all could see. They have owned it for quite a long time, and there's a lot of accumulation of things that their removal could allow for the place to be brought back to probably its original state, which I never saw because I did not grow up around here. So there's a lot, we try to recommend, take out all those pieces of equipment and things that, personal items and things that just shouldn't be in the food establishment that create that clutter, create that opportunity for harborage for any kind of, end disease or dirt or dust, and try to seal up areas that maybe, jimmies can flow under anything. I'm telling you, I could see them everywhere. And that being said, you start there. We would say start there, and then, okay, look at the bigger picture. Your floor is deteriorating. When would you be able to do that? We might have that discussion. We know you couldn't do it right now. Paint this wood. All the wood that's in there is getting old and it's porous, and, why not try and get rid of one counter, or, try and do one of the things like that. Last year, we had identified there was no mop sink. You put in the mop sink, not a problem. He did that without question. Just organizing, things like that, making things easier to clean. Unlike any other ice cream place, they don't close in the winter. So a lot of places close and then just clean out, and clean up. And max is 365 days a year. So you have to put that into your cleaning schedule. So we might suggest a cleaning schedule whether it be weekly, monthly, daily, and then training, of course, for employees. So it's comprehensive, that what we do suggest. So this report identifies things that are one-times and then repeats. So like the sanitizer bucket, they had them, but they, again, were high in concentration, which you can't have high sanitizer. Sanitizer is good, not too low, not too high. And when I asked the person in charge, they said, well, I don't do that. The
Well, I
boss-
do it in the
boss
morning.
does
I do
that.
it in the morning.
So the person in charge couldn't fix it for us. So we did it. So Shannon and I emptied all the, put water out and made every one of the spray bottles nice, and we call that corrected on site. So we put corrected on site, COS, on here. But, countertops being in disrepair, duct tape on handles, duct tape on tables,
That was
the
correct.
interior of the ice cream, units, and just not a daily type of cleaning going on. Just the dirt around at the edges and under, these things are, repeat items. And that is really, where the new code is trying to get us to not just come in and write these things down, but to actually help them create, or ask them to create the environment so that they have control of their place. They should have control, and we shouldn't be there,
I believe the
trying to be
rules
their
and
control.
regulations that we're trying to do is for businesses to self-police themselves.
Correct.
With a standard set of guidelines that are very explicit about what needs to be done. I mean, we're dealing with adults, so we're trying to make it simple without creating over-regulations.
Correct.
So that's why we have these guidelines. And it's in the person's best interest to self-police themselves, because sadly, and occasionally, we have issues now where self-police, and believe me, we are sympathetic to the trials and tribulations of running a business, but as Mr. Roos said earlier, times are changing. And what was possibly acceptable years ago is no longer acceptable, and there's just more potential hazards to the public that basically cause these regulations that need to be enforced, sir. So I didn't mean to cut you off, Ms.
No, that's fine.
Susan,
That's really probably all I needed to say. So,
And also the follow-up, you corrected the situation for that shift. I'm assuming the bottles were, the sanitizer was done, but was anyone aware of how to do it? Or
No.
is there any protocols or procedures in place to maintain that? So
right.
Exactly.
That's exactly what we're talking
So
about.
it's corrected for that shift, but it may not be corrected for
Right.
perpetuity.
So if this was a typical food establishment, and there wasn't someone on site that knew how to make the sanitizer, what is the minimum that should be happening or done in an establishment like that? Should there be a simple placard somewhere that talks about how to make the sanitizer? Or is it to call the person in charge of the serve safe person?
There's supposed to be someone on shift at all times that can answer the basic questions that we would need to ask at any time. And we wouldn't ask something like, that had nothing that did related to their establishment. I wouldn't ask the temperature of fish. I would stick with the things that are their
Pertinent to the.
biggest concerns, and whether it be, handling of how they handle the cones with the, a napkin, or hand washing, or sanitizing, those are the questions that I might, ask. And that's what we did, so. So, yes, you can put up placards, those are all great tools, we love those. And he actually has on the bucket, he has a line, a fill line.
And there's directions on the wall behind,
Yeah.
but they don't read them, I guess.
Yeah, it was strong, so, for whatever
Sometimes-
reason, so it was there, it just, whoever made it the last time, it didn't, I don't know who that.
There was no like list of the training. sometimes people don't read what they need to read, but when you run a business and you do have employees, there was no training protocol, it's like a timeline.
No, it's just stated that.
Just stated,
that
yeah.
Dad take, or,
Yeah.
sorry, the boss
And
takes
and
care.
We're well aware that employees don't always.
I'm sorry, but they're all high school kids working part-time, 12 to 13 hours a week, and they're kids. I know, they love the money,
I like the money, so they should learn the responsibility and
but I know it's my
part of
responsibility.
the training of employee.
Yeah, Member Scarano asked if there were test strips. There were, and we tested it, and that's how we knew it was high. It's actually, they use one that changes color, so you can even look at the color a little bit, so you can kind of teach people how to make it that way.
Well, colors are nice for high school students, for sure.
But they're not being asked to do it at this point anyway, but they couldn't correct it for me. Normally, what I would do is I say, okay, here, you do it. But there was one girl working, and she was busy doing a great job, and,
Is there a video resource or anything out there for people like this gentleman that might assist in training, or even referring his employees to look on their phone and possibly take a gander at anything that's available out there?
I suspect there's a lot of things
I do too.
online.
I think that there's all sorts of resources that are available, especially geared towards teenagers, because they never put it down. And
That's just part of the whole,
understandable, and this is what they're doing during work.
Oh.
They're texting, they're touching.
And that's a
and then
big stickler
they're
with
going
me.
to the food.
I've told them a dozen times,
So
no
you have to
phones.
understand
We
that part
understand
of
that. We
part of that problem is, again, I think difficult when you have people coming and going. But in a food establishment, this handling thing is the one thing that really has to be impressed. Hand to mouth, hand to phone, hand to door handle, all of a sudden you need to wash up. And that's the most basic thing, is hand washing after touching. And I think that's probably one of the things that you can implement with most of your employees, no matter what age they are, immediately. We're going to get to those types of things, and I'm just not going to, I'm going to let the director finish with a report.
what else would you like to know?
So I have a quick question.
Yes.
So normally there should be a person in charge. So at an establishment where it's a bunch of teenagers working part-time, and again, not talking about this instance, but in generality, would one of those people be assigned the PIC role, even though they probably need to have some training to back up that role, or would it be a more seasoned person that would fill that role?
Anecdotally, I think we've heard from other food places that they tend to have someone more seasoned on at the same time, but I can't say that you can't, obviously, you could teach a teenager to do things, but they would have to be a responsible party. There's not an age limit or minimum age for responsibility. But it has to be just a known thing, that this is a responsible thing. We do have other people who say, well, at nighttime, I don't have anyone who knows what they're doing. I said, well, you can't sell food then. So you have to have someone, and that's anywhere.
And the person in charge has to be on premise, not
So
accessible by phone?
they have to have, by code, they have to have someone who is trained in food safety. That person is responsible, just one person. They don't have to be there all the time, by this current code in 2013. We're on the 2013 code. 2017 code does require that, but we're not on that. It does require someone to be there all the time with a food safety certificate. In this code, it's the responsibility of that person to train the people working there in the things that they most need to know.
What are the ages of most of the employees that you have?
All high school.
High school, I mean, I'm assuming 15?
Minimum 15. I do have a few college kids, but they're gone come mid-August, come back till beginning of May,
15-year-old person
if they
should
come
be
back.
already trained. Some people think 16 you can vote, so I would say a 15-year-old person.
Oh, yeah.
I'm not saying I agree or disagree, I'm just saying that there seems to be a consensus out there that there are some people. So I would say a 15-year-old person properly trained, and I've seen it, would be sufficient to do their job, do it well, and, in supervisory capacity to oversee that, but it all depends on the training and the recalibration periodically, so that's why I was just asking. I understand, I try not to minimize the capabilities of teenagers. I do know that there's challenges, but I try not to minimize the capabilities of the youth of today. I think that if you give them the training and you give them some responsibility, I think that they're capable of doing a good job, especially in the kind of establishment that you do run. And always going to be challenges, but someone does have to be on site qualified. Okay.
I know that I operated a ice cream business for a little while, and I found that I was almost required, just by the fact that I was dealing with people that were dealing with ice cream, to have team meetings about how to scoop, how to cover, how to dispense, how to store. These were constant with the help that I had, and I know that they weren't all teenagers, but we had team meetings, and after a while, I didn't even attend the team meetings. They were holding them themselves because they were at least brought along a little bit about how to deal with the product, et cetera, et cetera. So, I think it's doable for you, and I know that you're not there a lot enough to do that, but I think you're going to have to come up with some concepts that are going to ensure that you can get your folks to comply. Just as you have to comply, they have to comply, and especially if you don't have a person on site that you can talk with or relate to check in with, I think these are some of the things that, we would be looking at recommending. And I think you've heard a lot tonight about some of the things that you could probably implement yourself, because this is a self-policing type of situation. You want to protect the public, but you have to be the leader on that as well. I don't really have anything else from a factual standpoint, except that the one thing I did want to do is discuss factually that there seems to be enough evidence here that the smoking occurred, that it has been occurring, and that there have been multiple violations. And we have a statute that, in a code of mass regulations, that require us to act. It's not discretionary. With this number of violations, you have to actually make a determination here tonight whether this is a habitual situation. Now, I think they're spread apart enough where it doesn't reach that level of habitual, but that brings you to the second level of inquiry under 590B. And we're here tonight because it's a 590B violation, the smoking, okay? And the question becomes, what is the remedy for a 590B violation? And it's multiple things that can happen, right? You can have a revocation of your permit for a period of time. That's almost a penalty. I'm not saying that we should do that tonight, but I'm saying that is one of the things that the board consider is revocation of your food permit, because this rises to such a level. I think you're going to address this, and you seem sincere enough to do this, so I would recommend that no habitual finding be made, and that we move to some of the other solutions under 590B that we can employ to help you, help your business, and help the public, okay? The second part of this hearing tonight, and they're going to make findings of fact, is that you have several violations here. Violations that, and I'm going to ask the director, how much time would be necessary to correct these violations, and do you find them an imminent threat to the health of the public?
So there are various levels. Certainly not, easy ones can be, okay, there's a bucket of water that has a scoop in it that shouldn't be there. That can be remedied immediately, right? You're supposed to use the dip wells, not have that, because then you have an environment that's unsafe. So, looking through this, one could identify all those items. He wasn't there that day, and it was with his son, so I just said, let's just write this all down, and then let's do this. And then as far as the other items, some things may need a contract with someone to fix, which means you have to, hire someone. Some might be, time to, it doesn't take a lot of time to clean a place out of anything that's not really necessary, old equipment, and then to move things around to make compliant areas. So there's storage in non-compliant areas, like in a garage of cups and things. That could be remedied if there's made room somewhere else. But we tend to, our job is not to do that for them. Our job is to write these down and then come up with these assistance or timelines for them to do it. And that's.
So in your opinion, though, there's no imminent threat to the public because of the violations? Or do you see something that should be corrected immediately because it could become a threat?
For example, not only are we talking about, cross-contamination for, possible, hand, mouth issues, but when you're in the food service business, this world, there's a lot more allergies for people. And I don't know if you've ever been involved or exposed to an acute situation when someone goes into some type of shock. For example, you get anaphylactic shock. It's not a pleasant situation for the person and the people around it. And we just think that when there's clutter, the potential for cross-contamination of some products that maybe could cause a situation. Hopefully you've never had one and never had to deal with one, but we just as soon avoid those issues. I mean, are there any potentials for that by the establishment being that needs, there's certain things need repair or certain things need to be organized in such a fashion to potentially eliminate those issues?
Yes, because if, you repair things that are uncleanable, then they won't harbor bacteria. So then every time someone grabs a handle that's an uncleanable thing,
Okay.
Once that handle's gone. So, I mean.
So it's more than that as far as
Yeah.
in the smoking, which I thought it probably was. Okay,
Yeah.
thank you.
So I think as we were looking at the pictures and you and I were talking, the floor is one issue. But then, as you were saying, it's the general clutter and try to declutter it first because it's much easier to clean with the clutter out and then focus on the food surfaces. Because that's going to be the immediate issue coming up is,
Yep.
assuming it will get warm at some point this year. And that will start getting more people coming to your establishment of what are the things that I guess could be most rapidly done. And it seems like it's getting all the counters cleaned and you're saying getting all the handles, everything that one would be touching in their normal performance of their job. The floors would be a long thing because that's going to be something that's professionally done. And I think too, coming back to your comment, Mr. Scarano, I really look at, we need to allow a window of opportunity for this to occur, but then also to provide an opportunity to make sure that things stay on the correct path. That we tend to now not so much worry about what's happened in the past, but we're more forward-thinking, want to make sure that problems that have happened in the past, for whatever reason or causes, don't continue moving forward.
Absolutely.
So, and again, it comes back to this idea of self-policing. So things that I'd be looking at would be to come up with a fixed schedule that these more immediate and probably easier things to fix. I mean, cleaning counters isn't a costly endeavor,
No.
but getting some of these other things really shouldn't be a lot. And those, to me, should be something that are done up front before you start getting into your busy season.
And as in other places where we've seen these repeat violations, it often is necessary to have some outside help to do that.
So we need a proposed plan with a timeline that gets submitted to you. We don't do it, they do it, they give it to you. And then we address, which will address all of the issues that you found with your inspection.
And it has to be done. I mean, recidivism will not be tolerated. This is the public health, safety. This is not personal choices, so.
But I think the pictures that have been provided to you for the report provide almost a self-executing plan. Because if I were to look at the pictures, I could easily go, I have a packaging issue. I have a storage issue for packaging. I have a storage issue for ice cream. I have some cleanliness to do by removing clutter. I have some surfaces that either need to be repaired or cleaned professionally. These photographs, right, almost lead you to the conclusion that you either need outside help or this is something that you can execute very quickly because they have to be executed quickly. And there are priority situations here that need to be dealt with. And this plan that you're talking about can actually come from the report, and you should check off every item and prioritize it so that you can provide a report on how quickly this can be executed. Because that's what this is all about. It's execution. You have some issues there that we feel rise to the level of almost immediacy. You have some issues there that rise to the level of needs to be done this week. You have some issues there that rise to the level of must be completed by the end of the month. Deadlines. So, and that's our next step as a board. We have you come back and demonstrate that you've met these thresholds, execution requirements, and deadlines. And then we can defer any penalties that we rightly could impose under 590 to another date in the future, depending on your performance.
Or lack of.
Follow that? Or lack thereof. If there is a lack thereof, obviously we can implement the penalties in 590B. And the most serious of, and the most, I guess, drastic would be, revocation of your food permit. But you have to put this plan together. We're asking you to either seek outside assistance and provide adequate assurances to the director that these things are going to be addressed. You need to come back in here with a calendar. Some of these things are imminent, and I think you can have a conversation with the director if you're confused at all about what needs to be done immediately. Immediately. And if you're confused at all what needs to be done this week, okay, and you're confused at all about what needs to be done by the end of the month, then I think that needs to be clarified with the director so you can move the priority to the correct position. And that way you're ensuring the public health and you're giving us a comfort level that we can give you enough time to come back and demonstrate compliance.
My
The other
best.
part of that is that it's not only coming into compliance,
Staying in.
staying in compliance is usually the harder part. It's easy to do that quick cleanup, that spring cleanup, but it's easy to fall back in old habits and let things accumulate again. So we're looking not only to make sure that you come into compliance, but that it stays in compliance. And one aspect of that compliance, in terms of having a clean environment, means there can be no secondhand smoke residue inside the facility, which means, and ultimately, as Mrs. Scarano said, we do have the ability in the regulation, the law, to actually withhold or not allow a permit to be renewed. So we're not even talking about that tonight.
And we don't
We
want
have
to
full
do that.
expectation that you'll be able to do all this and keep things clean, but you also have to realize that there is that potential penalty down the road of what happens if you're not able to do the things that you say you're going to do.
And we don't want to revoke anything. We want you
Right.
to come into compliance. We want to help you do that, but this needs to happen pretty quick. I mean, April is, not too far away, and ice cream season is here.
And you're by no means the first person to come before us with an issue like this. So we've had others, and we've handled all the others in the same similar fashion.
And I think that, just to reiterate, we definitely want to work with the people in the community. Our mandate is just to protect the public safety. So we want, and you're an established business that many people enjoy and go to. So, we want to work with everyone, but our mandate is to protect the public safety. And I'm going to speak from a personal level. We're not dealing with high school kids. We're not dealing, unless they own businesses, and maybe someday they will. And they're going to have to follow the rules too. But on the other side of the coin, we do have to protect the public safety. And, we're trying to have people self-police themselves, and all the guidelines, we as the Board of Health try to make it so it's a simple checklist to follow that is, serve safe, or whatever the parameters of your particular business are in food. But on the other side of the coin, if any relapse or recidivism, it's not going to bode well for the particular person in business, be it regardless of who it is, because it just can't happen. It has to be done right, and within the guidelines of the rules now. As they said, what was tolerated years ago, those were the rules. The new rules have changed. The public has a different perception of things, and we just are trying to protect the public in the best fashion based on all the guidelines and rules we have. And as I said, this is a sympathetic board because most of it have businesses, and we're all subject to those rules. And they're challenging and trying and frustrating, and everything that you have, everyone has.
Is this a public hearing tonight?
It's not a public hearing.
Then, I don't know, I think the operator has a clear understanding of what the board's jurisdiction is and what the board's ability is to compel compliance, and how he can voluntarily comply. I would like to just end the discussion by saying, I don't see an imminent health threat. I do see conduct endangering the public health. I think we can address the conduct endangering the public health through the director and through a plan that eliminates the conduct that is endangering the public health. The one thing that is imminent is the fact that there was smoking there. That's an imminent danger to public health. And we're going to, I would recommend that we revisit that issue after he comes into compliance, and determine whether or not any action needs to be taken on that, other than the fact that another episode of imminent threat to the public with smoking we would immediately act under 590B. Immediately. So with that, can I make a recommendation?
Sure.
I'd like to make a recommendation that we suspend any determinations as it regards to violations of the smoking, except to make sure that the operator understands that no further violations will be tolerated, and that immediate action under 590B will occur and could possibly close his business. Two, the conduct that's endangering the public health, if he abates the smoking, I think the other conduct is that he put at least a policy in place for his employees. And he discussed that policy on how he's going to try to eliminate contact while people are working. This hand-to-mouth contact, hand-to-phone, without cleaning up and washing up, this has to stop. That's the conduct that I see that probably endangers the public health. Because 300 cones, as far as I'm concerned, that's probably the low side during the summer. Each one of those is a possibility of a contamination. So with that, I would like you to work with the Director of Public Health and provide a list of repairs that will occur immediately based on what was reported in the inspection report. Repairs and remediation that will be done by the end of the week, or let's say within 14 days. And things that you will address by the end of the month so that you can come back here at the next regularly scheduled meeting and report to the board your progress with one inspection by the Director of Public Health, or maybe more, during that month period. Do you think a month is enough time to get your operation back in shape?
I'll have to get professional help. I'm 73 years old, I can't do it all
Well,
myself.
I recommend that you get professional help, because I think there are companies out there that can come in and execute some of these things for you immediately to take the pressure off you. I know not financially, but like you said, you're 73. I don't want to put you through this. I don't want.
I'll drop dead if I do it myself.
Yeah, we don't want you dropping dead, and you got to quit the smoking too.
No, I know that.
That won't help.
Just talking about dropping here, all right?
If I could get, sorry.
Let's do this. You report to the Public Health Director who, what, when, where, and how you're going to get this done over a month.
And she can help you with resources that are available. She knows who's on first with that stuff. She'll help you with opportunities with other companies that can come in and do certain things for you.
She knows of resources. She can't recommend any resources, but
No.
Yeah, I
Well,
know food safety.
I didn't
Right,
mean
she
I don't
knows
know
food safety,
I guess.
painters, I don't know plumbers.
you are an intelligent man. You've been running this business for a long time. The pitches here tell 1,000 stories
Yes,
that you can address.
it's old school
You're going
pitches.
to be able to do it. I know you're going to be able
Old
to do it.
school.
With that would be my recommendation. If anyone
I would be very appreciative.
expound on that.
Sorry.
No, I think you've laid it out very clearly and concisely.
It's an old school business, I agree, but it's a new
World.
time we're living in, so we got to come up to date a little bit.
Mr. Chairman, I only asked, does Robert's final-
Recommendation.
Recommendation include a second person being safe, serve safe?
I think that he understands
Okay.
that, he just went through the serve safe, okay?
Yeah, he just did.
He just.
Just
passed
renewed
the
it.
test.
Just renewed it today.
I would say that you have the team meetings that I recommend with your team, and that you familiarize themselves, especially with some of the things that concern us the most. Phones, multi-hand, without washing up and that's what's key about this. Go wash your hands and do it a lot. Just do it a lot. With that, I have nothing further to add.
And let me just follow up with you, Mr. Fernandez. That might be something down the road if this train, we're trying to, there's money involved, so we'd rather the money go into getting into compliance.
Yes, thank you.
And see what he's able to do to manage the rest, but we may have to look at that depending how things go.
Thank you, sir.
So with it, we don't really need to necessarily make a formal motion or vote on anything, because
No,
this
I
is
think our
just a...
recommendations were heard, and I think he'll follow up with the recommendations, and I'm sure the director will let us know if the recommendations aren't being followed, and he's due back here at the next regularly scheduled meeting, okay?
How long's that?
We meet once a month.
Once a month? Well,
Third Thursday.
So the next meeting date is?
April 18th.
We're inviting you back April 18th, so that we can revisit and review, account, and redetermine if necessary.
And please remember, we're here trying to work with you, not against you.
right, I'll do my best as I can, sincerely. Like I said, I'll probably need help. And
Yours is an institution this time. We'd like to see it keep going.
thank you.
Start with a
I'm
meeting with-
glad to hear that, because other people have said that.
If you'd like to start with a meeting with me, you're welcome to set one up tomorrow. So you can come on down or whenever you can.
All right, as soon as I can, because I have to go to my accountant tomorrow, taxes.
You don't have to
Always
start
so.
with me, but if you want to start with me, you
And
can.
I'll help too, so I'll help.
Thank you.
Sounds like you got a lot of people that'll back you up here.
Oh, they're getting the place when I croak.
Well, if you quit smoking, you'll have it longer than you think.
Yes, I know, thank you.
They're going to have a nicer place.
All right, should I keep this?
What's that?
Yes.
Yes.
Question,
That might help.
do you know if town sewer will become available anytime
You're not connected to town sewer?
that's not available?
I've
Well,
spoke with,
hold on.
Oh, no, there's
I
a
spoke with,
circumstance.
I spoke with Kevin, and there,
I don't have a connection.
DPW,
I don't
there's-
have access.
there's an issue of that particular location. And he's been
You
issuing.
have to
All right, it
understand-
goes down 38 and around.
Get through there.
Yeah, what you have to understand is that road is private sewer, went across Route
Give you the
38.
color.
So
Color.
there's sewer only if you pay for it.
No, he can't.
I don't-
He currently can't.
You can't.
No.
You do have it.
It's the way it's set up in town. It goes down 38, but then it goes around behind the buildings.
No, there's a
And there's
land.
about 7 or 8 of us
I
that
guess
are
there
on
you go.
sewage.
There's people that are in the know about this, and you'll have to investigate with them.
I'm happy about it anyhow, because it costs a lot of money to hook up the sewage.
Well, we wish you the best of luck.
Thank you.
Yep. Have a good night.
Thank you.
Well,
Okay, next under new business. Yeah, you take a break?
Want to take anything out of order? We good in order? What are we doing? Anything quick?
No, I think we just keep going with Keith.
So we're going to take a 5 minute.
Yeah, we'll take a 5-minute recess. We're live again. So we're coming out of recess. Welcome back, Tewksbury.
My little league, really opposite.
Okay, next on the under new business is Burger King, 85 Main Street.
You get along fine.
So if folks like to come on up. We got the sign-in sheet there for you. So as you're signing in, and before I have the director make an opening statement, I just want to make a brief statement myself. When we had you folks before us at our July meeting of last year, I fully intended that would be the last time we'd have to have you folks coming before us. And I don't take lightly, as the one setting the agenda, to bring someone that comes before us, but circumstances required it, so I'll turn over to the director.
Yes, I believe this is probably the third or fourth time we've had Burger King come before us. This visit was predicated by one of our reports received from the consultant that was hired, Ms. Maureen Lee, and her submittals. And I noted in February that some of the items that you all had put in that July meeting, that 1 through 8 items had still not been completed. One most important was the replacement or reinstallation of the food prep sink, which by the terms, basically, of number, 1 through 8, it just said initiate immediately the replacement, scheduling and permitting of the replacement prep sink. They initiated a permit in August of last year. and it had not been installed yet. I had spoken to a plumber many months ago. And then that made me look forward and realized, number one, number two, number three, for and a couple others hadn't been done, and I said, oh, my, it wasn't just the sink. So we issued a fine, $100, and requested them to come to discuss the issue. How this is continued. The fine has been paid. The sink has been installed. We've received the plan of the equipment. We've received the audit of the equipment, all within the last few weeks. So there's still a couple of things that we probably want to talk about. I don't think we received the 4-month interval. You just pointed that out to me, of the reports that they get. They do their own audits. That was supposed to be coming. So that's what brought this visit tonight. So even though they quickly got a number of those 1 through 8 taken care of, I still felt that this was important, that we come and have this hopefully final conversation. Again, this is the food permit, which is the most important thing that Burger King has with us, which is permitted to actually sell food. So you gave them clear direction, and this is where we're at now.
I think part of this came too, when you and I had a conversation, and I just happened to ask you out of the blue, how did the sink go? Because I hadn't heard anything, which I assume meant things were done in a timely fashion as we had agreed to at our July meeting, and come to find out that hadn't happened. So I guess my first question to you is, from the meeting of July, there were 8 specific items that we'd made in the motion that we asked to have done, with the idea that some of those would be done immediately. Our interpretation of immediately is not months after the fact. So I'd be very enlightened to understand why it took so long to get the most immediate thing, the replacement, scheduling, and permitting of the replacement prep sink taken care of.
Mr. Chairman, please excuse me for interrupting, but I have to ask.
Yeah.
Could you have them state their names? And the reason why I'm asking is because I was not in attendance last July.
Oh, I'm sorry.
As they answer that.
Yeah, if you want to state your names and addresses into the microphone.
Maureen Lee from Mogen Solutions, and I am their consultant.
Thank you.
Mavis Leo, Director of Operations.
Angélica Bento, District Manager.
Did you folks bring business cards tonight by chance?
I have it in the car. No, right now, but...
At some point, just because it'll help us with our records so that we
Sure.
correctly spell names.
So you were here last July, correct?
I was not.
The other lady.
You were here last July? Do you recall who was with you last July? Yeah, that's correct.
Rador Marmucha.
She's still with the company?
Yeah, he's still with the company. Unfortunately, he couldn't be here because he has some personal things going.
And he was the newly appointed manager for that restaurant, correct?
He was the person in charge at the moment when that happened, but he's not. He was transferred to a different area and is on different projects.
So there's a different manager now.
Well, the general manager the person that was in August, correct. That person is gone, and we do have a different manager, general manager.
How many senior level people have come and gone since last July?
No one. We just basically being gone from the company. Nobody. He basically being assigned to different projects or areas. But I was in your first one, in the first meeting. I was here. I did attend. But on the second one, which is basically when we were mandated to work with the sink, I was not. But I was aware of.
You're familiar with all the issues?
Oh yeah, absolutely,
correct?
yes.
Yeah.
Mm-hmm. Yes, I am, absolutely. So yeah, I can tell you a little bit what happened, or what happened with the sink. We, if you may, can I? Yeah, or you guys can? Okay. Rodwan, which is was our person in charge of the maintenance department, as well as operations to run. Was basically the person on point to run, the Department of Maintenance. We decide, there's basically we're gonna separate the company. 3 weeks ago, we went to the upper level manager, which is the owner, and my boss, and I said, it's way too much. It's basically, we need to have our maintenance facility department who will basically run our department, and nobody with operation, because there are so many staff that getting lost. Him running 8 locations and at the same time running a half a department of the maintenance department it basically is to track and to come to a point that I have, like at this one, there is opportunity for us. And a few projects that have nothing to do with Board of Health or anything to do with city, but different projects, that it was too much. So regardless, so we decide then starting next week, actually, we will have, the company is big, and we have stores in Chicago and Omaha, here, Connecticut. So it's big that we're gonna have, we already put in place, people in training, everything is going in the right direction. So now we will basically gonna be seeing a single phone call and not too many, okay, jumping from here to Angelica, I have to make the project, I have to supervise the project. It's gonna be one group designated to that to eliminate things like this.
Remind me, is this a corporate location?
No, it's not. We are franchisee.
It's a franchise?
Yes.
And how many other units are associated with this franchise owner?
Well, here we have 33.
33?
Yes. So it become too big because we're growing, we're building. So it's necessary. So the good news, we don't want to have this anymore because we have department, we already have the person who's going to be, one single call, and she's going to have the list of vendors that are available to us to use. And we have techs on the field that has been with us for more than 6 months that have received the training through them. So now we are ready just basically to let it go and leave us with the operations.
How is this going to solve?
The problems like this?
How is this going to solve a return visit back to the Board of Health for the violations that take months and months and months to first address, and then to continue a program to keep the maintenance and corrections?
Organization first. It's going to be organized because it's going to be a department designated to that. It's going to be people. It's not going to be like a Rod one who was here last time, who was basically, his job was half operations and he was managed the maintenance department. So it was kind of lost in somehow. So not that we didn't reach out the vendors. We did reach out the vendors. We did okay to the vendors to come to the Board of Health, to come to the plumbing department and apply for the permit. So we reach out right away because I know for a fact. They call me, say, whatever it takes, let's fix it. Because I am the one who gives the approval. It's gonna be 8,000, 7,000, whatever it is. I am the one who approved the jobs. So I say, whatever it is, please, let's comply. But we don't want to be here. I don't want to be here. I definitely.
May we just get to the chase in this respect? Because personally, I wish your company the best of luck. I don't care how fast you're growing. I don't care how big you're growing. I care about the facility in Tewksbury. And I feel that this has been almost a year for some things that were easily remedied and mitigated. So rather than delay the time in the meeting and the board, what are we going to do? Because right now, it seems as if the frustration level, we're not asking for things. We are the Board of Health. We mandate public safety. And we know you've had a person that's been monitoring you. I would just cut to the chase and know, how are we going to resolve this immediately? Because
It's resolved.
from what you're saying to me, sounds like there's going to be more delays and time delays, and I think we have many.
It's being
issues.
resolved. The sink is already being installed. That's what we're referring right now. The sink got
We have
installed.
other issues. Were there other issues as well?
The sink installation is,
Yeah, that was the quarterly reporting. I don't think we received that, do we?
So is there a written?
oh, no, the sink is already installed. It's
I understand
just,
you're saying.
Uh-huh.
We're off the sink.
uh-huh,
We're off the sink, and now we're trying to figure out,
uh-huh.
right? Is there a written policy on who's handling these things, and is there a responsible party designated under these policies?
Of course, we're gonna have, like I said, the department is dividing it. It's gonna be pure operations, and it's gonna be the maintenance department. You want me to send you that later? Definitely you can put it in her email and writing,
I
and
think you
yes.
should, I think that's
We
one of
will.
the things that you should
We
do,
will.
so that there's no fog
I understand. And
surrounding who's responsible and who's in the chain of command.
And I think we've been guilty, and so, definitely because the communication part is being our fault. It's been kind of, we lost it. We lost the communication. Like I said, we reach out to this first vendor, okay, who say yes, I'm gonna reach out to the city, I'm gonna go for the permit, and okay, so I trust it because he have done jobs for me in the past, and I let it go probably months, and the sink is not being installed, and then I said forget it. So then reach me out the second
This
vendor.
is really a delegation issue that you had with somebody who didn't follow through, and you had to step to the plate and make sure that it got taken care of.
Correct.
Now the sink issue has been taken care of.
Done.
And is there, other than the delay associated with this chain of command failure, is there anything else that we need to address with them this evening?
Well, there were two things. One, on the whole maintenance piece, while the sink was the immediate thing, our other concern had been, to your point, there had been a lot of other maintenance issues that need to have been addressed all along that come out of the natural operations of a restaurant or a fast food restaurant. And it sounds like from what I'm hearing that you have at least the reporting structure in place. But the part that I haven't heard yet, and maybe because we haven't asked, is, and I know we had specifically, or you had specifically talked about what's the preventive maintenance program, because we're trying to have you folks be proactive, not reactive. When we find something that's broken, not to have it take months to replace, but we want to know that moving forward, you have a documented proactive maintenance program in place that will continue to address these things so that when Maureen goes out there, she's not going to see any more maintenance issues that she shouldn't have to be finding. It should be done. So part of what I'd like to hear, or you can get back to the director, is how do you plan to address preventive maintenance under this new structure?
So, excuse me, if I could just speak to a couple of points here
Sure.
before we continue with this conversation. And I'm going to sort of back up a little bit and just sort of give you a summary of my report. So first of all, I want to say that from the operations point of view, the day-to-day operations in the establishment, they're doing quite well. Alberto is the new manager who is sitting here this evening. He's been there since July. He is very well versed on Burger King's procedures, follow through. He's consistent, and he's following procedures. I don't see a particular concern there. Yes, they've had a couple of, bleeps incidents, but overall, they're in compliance. One of the ongoing issues, and what brought them, first of all, to the Board of Health, has been exactly what you were discussing a little bit earlier, this failure to actually get work done, maintenance work done on it in a timely manner. There are 3 recommendations that I have talked to them about. So first of all, there also have been some miscommunications between Burger King and the health department in terms of what's required when they do make changes in their floor plan or submission of plans. And the first recommendation is that management and myself sit down so that I can explain to them exactly what the permit holder's responsibilities are and make sure that they are clear about that moving forward. And that we have talked about doing during our next audit. The second thing is that they do need a method to be able to track those maintenance work orders. And I understand from what Mevis has told me is that they've made a change. I have not seen a specific policy or procedure as to who this company is, how it's going to be executed. So I think that that is something that you would want to... Yep, that you would want to, and you could make it available to me so that we can include it in the next audit. And the third point is that there seems to be a lack of internal procedure for management to be able to even track their emails and their work orders. So, for example, Angelica is writing work orders and submitting them to Mevis, but then they're just lost in email. There's no way to follow up. And for a company this size, they need some mechanism to be able to keep them on task with these things. I have shown Angelica how to use her email so that it will pin it on top for her, or that it will give her a reminder. But the company really needs to either implement and train something for the managers to be able to use, or if the company has something, they need to follow through and train their managers.
There's no tickler system in place for any piece of equipment shown on the diagram, right? From a maintenance standpoint or from a preventative maintenance standpoint, right? There's no tickler system. Like, I know my ice machine.
They do. I'm
Okay,
sorry. So
that's
they
what
do.
I'm
They
asking
know
you.
that the ice machine is serviced routinely, the hoods, the ventilation system, and that type
And
of thing.
that's important.
Routine preventative maintenance, but not repair.
Not repair. So here's where I was going. Having a tickler system associated with the repair and a report from the repair person. That's where this maintenance thing breaks down. You have a person coming in and servicing, and what happens is that if there's something else that needs to be done, nothing gets reported or tickled in the future about what needs to be done. Do you have like a Dropbox system, or is there some system that might be added so that,
Those are things that they're going to be asking.
And that's
Okay,
what
and
it's
that
gonna
I'll be
But
following up with.
It seemed to me that this is just over a number of different franchises. There has to be a solution. And the solution can't be the franchisees taking care of it. It can't be. And we're looking at you as a corporate structure, which you are. We're looking at you getting corporate help because as a corporate structure, this is across the spectrum issue. This isn't just with the Tewksbury Board of Health yet.
Right.
This is across the spectrum. And we wanted you to get a solution, an across the spectrum solution. We're not asking you to do it tonight. It sounds like you're making some progress. But having this is pretty important. And it's not just for you guys. It's endemic. It's across a lot of different franchises, not just your company, right? But
can I add something? Sure. We did have that person 2 years ago. We did have the structure. We did have the maintenance department available to us. We did have the director of the maintenance department available to us because the owner has another business. But it was breaking in pieces, and obviously we become smaller. And we're regard because we own some other business, not only Burger King. So that is why we lost the person, because it stayed with the other side of the business, which is nothing related to Burger King. So now, because the franchisee is taking a different direction and moved to grow up with the Burger King side, and not with some other fast food industry, that's what we had. That's when we lost the person, and that's what basically it's been like a year and a half that we were kind of struggling. So now it's needed. Now we know what to do.
How long have you been on board, ma'am?
How long have I been their consultant?
Yeah.
So we started in July?
July.
In July.
July or August?
Okay.
Yeah, their first report was done in June 25th.
And at first you were going to be to December, was that the first?
Correct.
Correct.
Yeah, last December, and then we.
And then
And then you extended.
to
And
July.
this got extended. Right, and January was missed as well. So there's communication issue where they didn't seem to know that it was supposed to go to July. So Ms. Lee held off on January. So we did miss, that was another thing that came up, and I said, you know,
So whose responsibility would it be to take the next logical step in developing some sort of remedial system? Would it be your recommendation to them, or would you investigate what's happening in other locations or from a corporate standpoint to see if they've addressed any of this and try to incorporate it as a solution for these folks?
I am only engaged for their work here in Tewksbury.
I see.
Right.
Yeah.
So it is up to them
So you
to
would make a
investigate
request
this, and
for
I will
information.
follow up
Yeah, you would make a
at the
request for
audit.
information to them.
Right.
They would go through the process, they would report back to you, and hopefully you would be able to implement some solution. Set?
Well, the department is already going. We just basically, they are acquire this site
Yeah.
of, for us to put it together. The department is already there. So I just have to give it contact information, what to do, and get all the information
We
from
can
the
expect
office.
some sort of report from you on how this is progressing.
Sure.
And how long do you think it would take to get that report?
So I have asked for they're telling me they have everything in place. It would
She
just be a
has it
matter
in the
of
car
getting
if you
it to
guys
me.
want to see it,
Oh, no,
because we
no.
already have the
No running
meeting.
to the car.
Okay.
So, so
okay.
there's,
Tomorrow we scan it and we send it over. It is,
Why don't we at least get that resolved?
Well,
Why-
no,
wait,
it
wait.
needs to be reviewed.
Why
It
don't-
needs to be reviewed.
why don't I look at it first
Yeah.
before it gets submitted, so we don't run into
Perfect.
more confusion?
That seems reasonable.
so give it to her today, the page. Okay.
What else do we have?
The other whole part of this was, and you can talk about this, Maureen, besides the maintenance, we had just the ongoing food safety code issues. And we've been talking about what was going to be needed for training and what could they do to proactively keep people trained and self-police to make sure that violations were not occurring. And we've realized realistically, you're never going to have a inspection where there's not a single thing found. But what we were just seeing over the time, whether it was health department or Marine doing inspections, that we seem to see things sort of happen over, and I realized that as we've been moving forward with the inspections, there have been fewer issues. And I think you had provided a quick summary report, at least to the director me about that, Maureen, tonight before the meeting, of just
Had there been any relapses,
Trend.
Michelle, of any of the things that you thought were addressed, and then there were relapses of things that were corrected?
I would say relapse, no, I would not say relapse. There is a little bit of a spike here in February, but it was related to, one is a new code requirement for the 2013 food code. Okay, which,
So we've
I
been
would
making
expect.
constant progress.
Right.
But, we don't want to.
right. And then the other two that were here, one of them was a new person that although they were hired, once you get them on the floor and they start working, there needed to be a little bit of correction. And that was taken care of right away.
Okay, well, that can happen, that's fine. It just,
Right.
as I said, when you have corporations and they're doing things, it's like, it's always best to have, there's always going to be issues running in a business, but what happens is, they should be prepared for these. And as I said, we're just concerned about what happens, or I'm concerned about what happens within Tewksbury and things that should be simply addressed. And our position is not to be sympathetic because of the complications a business is having. Our position is, what can we do to mitigate the situations that have been identified, and what can be done to keep it from happening again? Or, and I know there were issues with just communications, a matter of who to contact, and it's like, if we can't get a hold of someone from if there's not a chain of command, we can't get a hold of someone in a violation, and we just get that we can't get this one, or this person's not getting back to us, then basically, the way I look at it from our board is, if we can't, it's not up to us to be chasing people. Our mandate is, if we have to do something drastic and revoke a permit or whatever, then so be it, because sometimes that's all that gets people's attention. And then things get done really quickly, especially in a corporation. I mean, we're not talking one person is struggling. When you have 33 facilities in Massachusetts alone, I would say there's some substantial financial backing that can address this. Because if you're not, then you really, I don't see how you can stay in business. That's all I had to say on that. Just
Mr. Chairman, do we need to, Maureen Lee has submitted recommendations on the back of her final report, the last report that we received. Can we take a quick look at those recommendations?
Sure.
Yeah, she just provided.
Do you
those
have that?
tonight. You hadn't seen them. I have actually.
You hadn't seen them before, right? They're just tonight?
Not before tonight, no. Susan hasn't seen them before tonight.
Just for the record, we're going to take this in tonight, okay, because we're considering the document. So we're referring to Maureen Lee's report that is submitted, and it is dated Thursday, 3/21, 2019. So it was done today, late today, and it has some recommendations, and I'd just like the board to consider the recommendations, and should we read them into the record?
I believe we should.
Okay.
Yeah.
The recommendations were management staff training, permit holders, responsibilities as required by the 213 code, and CMR 590, right? So the staff training is one of the recommendations. What we talked about was addressed, and it's addressed here, as a tracking system for maintenance work orders. It seems that they recognize the problem, and they are now recommending a course of conduct and remediation to address that. The third thing is here, they have Northeast Food provide tools and training for management to effectively manage and track their internal communications, correct? It would seem to me that these three things address some of the concerns that were brought about and why you're here this evening. And as it relates to the violations, I think we have to look at those, right? So does anyone have any input on any of the violations that were reported?
My only comment on the violations reported was, it seemed like there was over the course of time, sort of a training or coordination or lack of effort that was causing some of these to happen. And so one of my thoughts had been, as it's been said earlier in the 2013 food code, we do not need, or restaurants do not have to have a ServSafe certified person on staff on each shift, but the 2017 code does. So one of my thoughts was to potentially having to make sure that there is a ServSafe certified person on duty on each shift, which in some cases would be the manager who's already ServSafe certified. So it's not adding someone, but it's more looking at to make sure that there is someone there that...
You have adequate coverage.
Right.
And we're not looking at overlap, we're looking at just adequate coverage.
Sure, excuse me, though, that's a Burger King standard
Burger King
already.
policy.
So they already have that in place.
So that's great. I'm glad you're already working towards the 217 compliance.
Oh, yeah, minimum we need to have in the
I
restaurant
think that's wonderful.
3 or 4.
Do you have anything else you see there?
No, I guess my other question would be more for the rest of the board. We had extended Maureen's inspections out through July. It seems like they still have some systems they have to get in place so we know that everything is going along the correct speed. And being this is March, so April, May, June, July, I'm wondering how the board feels about maybe having this continue up through the end of the year or keep it ending in July.
I would feel more comfortable if I had closer reports from Maureen so I could monitor the situation. So if we were to bring the reporting to maybe even every 4 weeks or 5 weeks or 6 weeks, would that help?
So right now, they're every 4 weeks,
Right.
right, monthly.
So if we brought it closer, is there any reason to report any sooner to the Board of Health? So that we could look at whether or not we need to, yes, we could look at whether we need to continue you past July. Because we're looking more, not just from a report, but from an expectation standpoint.
Correct, correct. So I guess, that, the question is, what is left outstanding here are the recommendations that I made, which we should be able to gather that information, assuming it's in place, as I'm told, within the next month, right? And put together the report, and I can double-check everything, verify everything. At that point, what's really out of compliance here or needs improvement is that communication. Whether it is within the company or between Burger King and the health department. And that is something that probably is, I'm not going to be able to measure that on a monthly basis. That's going to be per occurrence, per event. So I'm not sure that it would be beneficial for me to continue on a monthly basis to be and be able to assess that.
That's what we need, all the information to make an informed decision. So the more information that you can provide us on how you're going to get to compliance and how you feel, because your opinion is important here. We want to know that these people can ride the bike on their own.
Right.
And your opinion is what's important to us because that's what allows us to make an informed decision that we can actually take a step back and still get the level of public protection that's necessary. And we're looking for you to opine on that. So the question is, what information do we need and what information would you like to provide us so that we can make an informed decision whether or not your services are required after July?
And there's one other piece. What we had also asked for in the motion in July was that Burger King provide their 4-month interval reports to the health department, which has not happened. So having that additional information from a different set of eyes only provides a bigger picture.
You have those? Your company that comes in and does your quarterly
that's not every
audits.
month. It's
do them
they only do quarterly.
Yeah,
three
every 4
times a
months, so
year.
3 times a year.
Yes, 3 times a year.
And we'd requested that back
We do
in
have those, yeah,
July.
absolutely. We do have that, we can provide you, send all the reps.
So to bring you into compliance on that one, I think you should get the reports over to the
We send it.
director.
Every
And then
time we
can
get
put-
one, we will,
We can put that,
Forward it
we
to
can
you.
put that to bed. And then we'll be looking for you to bring a summary to us almost, so that we can make a determination whether or not your services are required after July, and if they are, what level of services are required. Certainly, we're hoping that they can ride the bike sooner than later, but you're going to give us the information, I hope, to provide us with the ability to make that decision.
Okay.
sounds good. So we will forward to you the information that you need.
You're going to send it to me?
Yes.
No, I think
Yeah,
that covers it.
Do we have to
rest,
summarize this?
inspection for
Are you okay
Oh, no,
with
the
the
inspections.
recommendations?
You print it out and
I'm
send it.
fine
send
with
it
the
as well.
recommendations, it's unfortunate that we had to come to a point of having to write another letter and fine $100, and I just don't want to see that happen again. You wouldn't be here otherwise. We would have just had a conversation, but it was just, that's what it took.
Well, thank you for coming in, Hillary.
Thank you.
Thank
Thank you. It was a pleasure to finally get to meet you, Maureen, after reading your work.
Yes, it is.
She can go and help the previous,
What's that?
she can go and help the ice cream place.
Don't take our sheet, if that's what you're about to do.
Thank you.
She almost took the
Okay.
sign-in sheet.
Moving into discussion. Finally, Ron, I'm sorry it's taken us this long.
I owe you a chicken dinner, I think, huh?
Come on down, Ron. So we have two items under discussion tonight. Caps in both body art permits as well as tobacco sales. And Bob, since you weren't here the last meeting, the tobacco sales permit cap arose because Susan had, someone was interested in potentially opening up a tobacco-only store in town, and was also aware that towns around us are either have caps or in the process of implementing caps. And we figured it was a good time for us to talk about whether we in fact want to have caps, because if we don't, then all those folks that are looking at setting up shop in the area towns that have caps will come flocking here.
Well, I might as well just say that I'm against caps on both issues. Get that right out there.
Well, I'd like to know what the level of service is, right? So our town compared to Wilmington, for instance, what other towns, I'm sorry, Ron, what's the best town to compare ours in size to someone else that you're monitoring?
Well, Andover is similar in size. They're a larger community with 33,000. I think Tewksbury has, what, about 29?
And how about the number of dispensaries for Andover compared to what we have?
Well, Andover has 12. I believe you have 28.
All tobacco together.
All tobacco together. Yeah. I did look at, what are the communities in the area. Bill Ricker also just has a permit cap. I can tell you I can leave this with you. This is a list of all communities that have some type of a permit cap. It's 123 communities in Massachusetts with 22 cities, and they represent about close to 40% of the state's population. In our collaborative, the communities that have a permit cap are Andover, Billerica, Haverhill, Middleton, Newburyport, and North Reading. I don't know of any communities that are currently in our collaborative that are looking at a permit cap. Billerica just a couple of weeks ago added to their permit cap a cap on the number of retail tobacco stores, i.e. vape shops, smoke shops. They have one. They put a cap of 3. And also, just as a sidelight, it's not on the permit cap, but Billerica is the first that I know of, certainly the first in our collaborative, and one of few in the state who have made the bold move of removing all vape products from convenience stores and the like, and will relegate them only to tobacco stores.
I find that reorganization refreshing rather than capping. I find reorganization for more control, like vape does vape, and tobacco does tobacco, and cigars does cigars. I think a lot of those consolidation type things are good as opposed to caps. Is anyone even looking at that from a standpoint of community?
It's looking at the segregation. Well, yeah. The only thing is of course, Bill Ricker got some attention from folks in the legal world, and so there's going to perhaps be a challenge to it. Needham and another town that I can't recall, I think it's Ashland, are currently look like they may have some legal action against them. The general thought is that the case against them is not strong, because there are many arguments to say that menthol, mint, and wintergreen are actually more insidious flavorings than perhaps cognac or apple, due to its specific ability to make things less harsh, smooth, cooling effect. On the capping, I spoke actually today with, we had a statewide meeting, an all-day statewide meeting today, and I spoke with their chief epidemiologist, Glory Song, and she did provide me, I'm sorry I gave that to you late, Susan, but I sent you an email later on this afternoon after my meeting, and it's a couple of articles that you can be shared with all the board members as to the rationale of capping. As we've always said, some communities have looked at 21 as sort of the magic bullet to cure things, but you through your work on tobacco control matters know that it's a multi-layered approach, that they work in unison. And so I never want to say one is more important than the other. In terms of the argument for the cap and why several of the communities have gone with it, certainly not the majority, but it's growing, is that there's these peer-reviewed research from medical journals as well as the National Institute of Health who've said that the density of tobacco distributors is related to and correlates with higher use by youth. A couple of reasons for that would be the advertising. Most of the advertising and marketing dollars that is spent by tobacco companies is no longer due to a consent decree agreed to many years ago, that they can't put up big billboards. Of course, there's no radio, there's no television, although those issues with that, with the vape right now, those are still allowed and those get through. But the majority of the dollars that are spent in the whole country, as well as in this area, is on the point of purchase. That's why the tobacco displays are not hidden under the counter generally. They're prominent and up front. That's why there are signs on the, maybe at each pump at a gas station. So that is where the money is spent. That's where the promotion is spent. It's up to everyone else to decide why it is there. In terms of opposition, it's one of those kind of, every town deals with it a little differently. North Reading did it by giving a cap, but added a few more establishments so that they, for business reasons, if somebody wanted to come in, they'd have a little bit more on the cap. I also did a little bit of, and I can do more research in regard to this, but in terms of density, Andover falls into, 2767 per retailer. A lot of them fall in right around 1,000, such as Tewksbury at around, 1,034 for every retailer. There's also breakdowns of how many youth, but I don't have accurate data with that because I checked the state's numbers and they're off a bit because they didn't account for the loss of some tobacco permits due to no pharmacy sales now. So I didn't want to present those to you.
But density has a direct correlation to availability and the availability to the youth market.
Yeah, I mean,
When you say that is at least a conclusion?
There's definitely literature that supports that argument. And also, we're in a state where we've had a long-standing adherence to caps for liquor licenses. And this reminds me, this particular policy reminds me of, it's not the cure-all. At least I don't believe it is. But it can be of assistance, especially down the road. The pharmacy ban, which you
Don't have.
didn't have, or you don't have, but you do have now due to the state law. And why there seemed to be a tidal wave of movement on that, and some agreed and some didn't. I'll tell you that honestly, some of the convenience stores that were close to the pharmacies, in Haverhill, for instance, when they adopted this, they said, Ron, usually, we have a lot to say against what you do, but thank you. On the pharmacy ban, the board, they were glad because it just transferred the sale to their store. But I think something in the long range, and this is something Canada realized many years ago, that if I was a tobacco representative and I wanted to put the best shine on my product, regardless of whether a lot of my sales came from there or not, I can't think of a better place to put it than in a pharmacy, because it adds legitimacy to the product, along with the medicines, along with the, the prescription drug counter in the back. I have a great big display, just like the convenience stores. So and then there's the other, I don't know if you adopted this, I took a look at your regulation. I'm trying to figure out, you might remember the history of why it maybe was included or not, but a lot of the towns, and I didn't calculate this, but a lot of the towns in our collaborative have a $500 buffer zone for new establishments to build or establish their business near a school, within 500 feet of a school.
I think it's because
You didn't
we've
adopt
got, now that because that's more of a zoning,
That's what, yeah.
then there's no health impact to a buffer zone.
Yeah, the reasoning for that is there are some, again, Ms. Song, the epidemiologist, there are studies and maps that are put together on proximity to schools just to kind of, they used to be, in the old days, they used to be get as close to a school as possible, so that you get the traffic for the students and such. But I'm not going to tell you that permitting is the end-all and be-all. But it certainly is getting more traction with half of the 40% of the population in a community with a cap.
Here's my question, because Wilmington, I was doing research this afternoon, they've capped it at 25. So Wilmington has a cap, Andover has a cap, Billerica has a cap. So 3 of the 4 towns that border us have caps. And I was trying to wrap my mind around, so what does that mean for residents here?
Sure. Well, Newburyport's gives a good example of that. There's this, now with more with CBD and hemp establishments coming into business, we had a situation in Newburyport where they're capped out. And there's 2 different types of caps. One is a cap that says there's a certain number. And then there's a cap that also, which Andover has and which Newburyport has, which is if somebody goes out of business or doesn't renew their permit, it goes down by that number. It's sort of an attrition clause. And there was a store that wanted to come in. Now, Newburyport doesn't have a vape shop or a smoke shop. And somebody wanted to come in, but they can't. The only way that it can happen is if one of the existing stores transforms their business. And if it's a gas station, that's probably not going to happen because you have to get rid of your gas. If it's a liquor store, it's probably not going to happen because then it's not a liquor store to get rid of the liquor. It wouldn't be a good trade-off. So we did have a place in North Reading that they did make a change. So here in Tewksbury, I can just tell you I get several calls, not every day, not every week, but it happens fairly regularly where I kind of liken it to someone with an attaché case moving from town to town to see if they can set up shop. And just to let you know, this one is not as popular, and I think there's only a handful of communities, but I have 2 of them right now, which have a cap within a cap. And that was Billerica that I mentioned. They went from 1 to 3 for a cap for smoke vape shops, as well as Haverhill. Haverhill had 4, only 4 for a population of about 60,000, and they capped it as is. This frustrates folks that want to come in and set up shop. There's an alternative view, by the way, and some adopt this, and that is let the marketplace decide what a saturation point is for vape shops and smoke shops. How many vape shops and smoke shops can be supported? But that might be more than that some may desire.
Well, my concern too is that
I think is an issue of subsidization by other businesses located in the vape shop, like some have lottery, some they have the ability to survive or subsidize through some other mechanism in their shop. So, I'm a little hesitant to think that, they wouldn't be able to stay in business for a long time. So this retirement idea of when they finally retire, If they're subsidizing it by some other mechanism in their business, there's never going to be retirement, or there's never going to be a declining ratio of shops.
That's actually, you've hit upon a somewhat ticklish issue with the definition of what a retail tobacco store is. And Tewksbury is not alone in this. You mentioned lottery, for example. The way your regulations are written, as well as all of the other communities, is in order to operate as a retail tobacco store, you have to satisfy three major components, and that's one, you never allow anyone under the age of 21 to enter. You never sell any product that requires a retail food permit. And the third, which is the one that is sometimes overlooked, but it's very important, is that the primary sales in your business are tobacco and tobacco paraphernalia, tobacco in the broadest sense of the term, vape and all that sort of thing. And whereupon any other product, I'm paraphrasing, but fairly it's accurate, or it's accurate, but not exactly precise. And the sale of any other item is merely incidental. It's up to each board and health department to decide what is regarded as incidental. Now, with the question of lottery, I think most would argue that lottery receipts are not incidental. They're a significant portion of proceeds. I mean, but the issue in Tewksbury and as well in Billerica was that some of the shops that were here that were basically engaged as a tobacco shop, but not strictly as such because the flavor restriction didn't come into play, they already had the label. So there wasn't really a big push to move that out. In communities that started with the flavor restriction and never had a lottery, or had tobacco shops and never had a lottery, the boards there have said, no lottery. You know, we want it to be nothing else besides a tobacco shop. So
And that's an easy determination because each lottery agent gets a commission check based on the sales. And I'll tell you what, most prominently display it right in the store.
Yeah.
This store earned X amount of dollars from the lottery last year. And, you know, again, I think those things can be looked at, but, you know, they have to be enforced too.
yeah, and there's also the issue, I guess lottery is open to people that are 18, 19, and 20, and of course, those customers are, by law, and arguably it's, we are not doing checks on that at this point, but they could be done.
So one of my concerns is percentage-wise, our tobacco retailers are batting 1,000 for sales violations. And could we entertain having a cap on tobacco retail sales and not cap the retail establishments that also sell tobacco that have a license?
Sure. Yes.
And that's honestly my bigger concern. And the other part is on the tobacco paraphernalia, which is used for more than just tobacco. Have towns successfully stipulated that those paraphernalia items can only be purchased in a tobacco retail store?
Fascinating question, only because I've seen an uptick in two things. One is the amount of pipes and other accessories in retail stores displayed. Of course, they're not, it used to be before marijuana use was legalized that there was a sort of usually a little tag that said for tobacco use only. And, that's not necessary anymore. I don't know enough. I read the marijuana law a couple of times when it first came out, and when I read it, I think it's accurate to say that a pipe is a marijuana accessory. I think that's the term that's used in the law. However, I don't think the Cannabis Control Commission has, it must be apparent, they haven't, while you can only sell marijuana in marijuana establishments, that doesn't seem to be the same for marijuana accessories. Have to be brought up by the Cannabis Control Commission, because the sale of them and the possession of these pipes, et cetera, is legal. There's no issue The only thing I've ever quarreled with is sometimes there's these pipes that are at the stores. Crack cocaine, and I encourage them, just as a person, to not sell those.
Hasn't that always been the case? I mean, I'm going back when I was 45, 50 years, when I was working in convenience stores, and they were selling rolling papers in
Yeah,
the
and-
stores, and they had cigarettes. I mean, I don't recall people rolling their own cigarettes, so.
I don't know, there was a point where people were selling bulk tobacco, small rolling machines. I mean, that stuff went together. But you could track the number of purchases on the rolling papers with the number of machines that you were.
Well, yeah, but some of, I mean, I do understand that, but I don't remember the rolling machines being sold as well. I just saw the papers, and this is going back to the implementation of the lottery. I just remembered it was, seems like that issue's been around for a long time.
So did you come to a conclusion about a community that is being squeezed by caps that surround them on all borders? So let's say we have one community in the middle and we have several communities that are bordered with caps. Do you think that's driving any more people to the, let's say, captured community without the caps?
Maybe with the attaché case, right?
Yeah. Well, yes.
Is there any numbers associated with that? I mean, are we seeing that there's huge applications of people trying to get into communities without caps?
No, I mean, you have a more clearer example, but it's not the same, is that you did prohibit smoking bars. So I used to have folks call offices that I work, the other health departments, and they're looking to set up a hookah bar or a cigar bar or that sort of thing. Had pretty good, in our collaborative, there's just a few towns that have not come forward and said they don't want to prevent a smoking bar or just haven't implemented it. But most have, and I've seen that. I can't give you any numbers, and I think really it's up to each board to decide whether or not they think the marketplace is going to take care of things or whether or not the permit cap is a helpful assist. And you did mention, in terms of enforcement, of course, it makes it more difficult because they are the emporiums of flavored tobacco, and the whole idea of them was supposed to be for there to be strict adherence. And certainly the fewer there are, the easier it is to manage in terms of enforcement. You won't get much, for fairly obvious reasons, you won't get much pushback if there was a hearing on a cap on retail tobacco stores. You're not going to get much pushback from existing stores.
Is the jurisdiction entirely within the Board of Health's realm on caps?
Yes.
No one else can chime in?
Well, I don't know if, I don't know of any zoning board that has done that, but I do know that there's been no challenges, and this is recommended by it's offered by the state as a set of model regulations that a permit cap is a legitimate.
So there's been really no challenges by outside to the cap?
No, and again, you're not going to get challenges from within too much because it can be a criticism of it, that it increases the value of your permit. Although it's not sold, we don't sell them. Unlike liquor, which I don't know too much about liquor, but I understand that there's a process by which people purchase.
You have a business, if you purchase the business,
Yeah.
that does make your business worth more.
Absolutely, yeah.
Now, I put this forth not because I'm for or against it. It was more, and not trying to keep up with the Joneses, but rather knowing that towns around us are doing this. I wanted to hear from the expert of what you thought caps would do or not do in terms of trying to, at least, if our goal is to try to prevent youth from smoking. And it's not about preventing over 21 folks from getting their tobacco products, but for the teenagers. That was my more question about would a cap help us in that, but in the same token, I'm also more concerned about the increased prevalence of youth and vaping. And I think if we had to come up with a choice, I'd rather look at what could we do, is there anything we could do regulation-wise to try to stem that tide?
Well, of course, Bill Ricker did both, but it could be argued that Bill Ricker's bold move to remove all vape products from convenience stores has more immediate impact. By the way, today, just tell you what was discussed at our meeting today is Needham has done a complete menthol, wintergreen, and mint ban. This would remove major cigarettes off the shelves of all establishments, relegating them to only the adult only. And the state has now given us the green light to encourage communities to offer that as a restriction. But it does come with some risk of a lawsuit, and put up front. But Bill Ricker's gone forward, Needham's gone forward, Somerville's gone forward. So it's gaining traction.
Lawsuits is probably more geared towards the menthol products than the vaping products.
Well, it's probably why the FDA, when they did ban flavored cigarettes, they didn't include menthol and mint and wintergreen. I think part of it is Newport is the second most purchased brand of products in the country, so.
And now it's been proposed, and now that director is leaving. So that's very interesting, so.
I don't know enough about Mr.
He did
Dr.
propose
Gottlieb's.
it, and now he's decided to step down. Speculation? I don't know. But that doesn't mean the idea of the menthol, banning the menthol has gone away, but it's just an interesting development because no one has brought that up in a long time, and this FDA director did bring it up.
I don't know. I guess people would have some Commerce Clause argument or something else on, especially if you were, let's put it this way, you were on a state line store, might have some validity to that.
Yeah, the one thing I think that's in the feedback we've gotten from DJ at the Mass Municipal and Cheryl Savar at Mass Association of Health Boards is really, I mean, just looking at it on its face, how can a board, the language that you passed was essentially close as you can get to lawsuit proof because it had been tested by the U.S. District Court and the U.S. Court of Appeals in the First Circuit, and the tobacco companies lost, and it never went to the Supreme Court. This one here is just, it's, to say just would be an understatement because it is a huge impact on the retail community and of the tobacco companies. However, logic-wise, there's no difference in the logic of why a Board of Health would want to stem the tide in terms of mint, for instance, Juuls are very, very popular. The kids have kind of shifted more from a mango to a mint. Mint or menthol are the two big. So it's the rational basis that Chapter 111 provides to you seems to be clear. And there is a great deal of confidence that this will be upheld. We don't know that yet, so it's important.
So it comes back to vaping. If we are looking at trying to find a way to minimize youth from vaping, it seems like it's not with the vaping devices, because you can order those online. There's no way we can intercept Amazon deliveries and have them scanned and make sure that.
Well, the Attorney General's office is doing some of that stuff, actually.
But I'm thinking it's more.
I think it facilitates.
Vape juice.
I think it would facilitate it more by having more. I mean, we're trying to be concerned about, youth becoming involved with vaping, and I think that the more entities that are out there, especially since we're surrounded by communities that have caps, you would think that just the trafficking or the accessibility would maybe have more people come to a community that has more facilities available, and just, that's what I would think would be obvious is the more access they have, they'll be coming into the community, and then not counting the potential variables and issues that can come up with young people trying to access those facilities.
I think the cap itself doesn't do as much justice to stopping the youth from smoking as the removal of those products. And it would seem to me that our particular position is that we don't have a cap. Therefore, what is the best way to get them to stop? Don't have it there. It would seem to me that, you know, rather than affecting people's bottom line on selling a product that they've been selling for quite some time, and the main objective being to stop the youth from either starting or continuing, that removal of the product itself, and I forget which towns you said have done that, would seem to be the most effective means rather than putting a cap on here. And I'm not going to commit one way or the other for caps, but, you know, as an objective, if it's not here, they can't come here and they won't buy it. I mean, that's the bottom line. And the product, it seems to me, is dangerous enough to be able to make that determination. Juul itself has admitted it's dangerous, and it hasn't even, it's attempting to try to mitigate, and it's failing miserably. It basically shifted everyone from one of their products to another one of their products. That's what they did. They literally came out and said, we're going to dissuade people from, no, they didn't dissuade, they switched them.
Like diet soda.
They went from one to another, and you know what? The same thing will come up again, and it will be a switch to another. So, the removal of the product, you know what? I think the likelihood of a lawsuit is a lot less with the removal of the product, period. I think they have a tough road to hoe. And I don't know who wants to make that argument, that it's not a dangerous product.
Well, and you had very illustrious point, and that was about the advertising, and focus the advertising where the product display is.
Yeah, that's what these
And by
studies.
pulling, and I can see the value of pulling the vapes out of the stores where there is no minimum age to enter, because then you're not going to have people looking at that advertising.
I'm all for getting it out of the general traffic pattern and
With this
putting it
no
into a
minimum age.
controlled situation.
Okay.
So if you had vape
Yeah.
and it was available in a general traffic pattern, I'm worried.
Okay.
But if it's in a place where it's age restricted and that's where you got to go to get it, well, is it any different than what they're doing with cannabis? No, it's not. And to be honest with you, those type of control situations are being accepted more and more by the public. So that's why I see less likelihood of a lawsuit for having people have to remove that vape product
May not get a
from.
big lawsuit, but the public hearing will be,
Oh, of course the
outrageous.
public hearing would be,
Outrageous.
but now you're balancing the likelihood of taking years off of a child or an adolescent's life as opposed to a marketing and consumerism issue. I'm not going to say you can equate the two. So the public hearing would be brutal, I'm sure.
yeah.
But maybe that's where the tweaking on the cap thing needs to be made, and people, and those things need to be more consolidated where that use is happening under a controlled situation rather than a walkthrough situation.
Segregation seems like it has some merit.
And if we were to go down that path, and knowing the percentage of sales violations with this place now that we'd like to ultimately be the more controlled seller of these products, is there any reason why we could not possibly look at two different fine structures? So we fine those that are in that more controlled environment
And you will then effectively make our town more attractive to people to come and open over 21s, because they will have a product that none of the other dozens of places would have. So you then really would need the cap, because if you take all that paraphernalia and put it into over 21 stores, you now have given them a whole new market. And even some of you weren't in the discussions back 3 years ago, but even the vape stores stood up and thought that it was unfair to take the stuff out of the convenience store and the gas stations and give it just to them. They go, thank you, but you're hurting these people over here. You take then more things out of their store and give it to that. You've now made it attractive to
Kinda
come.
like the liquor stores
to it.
of old.
So if that was something that you really wanted to do, and if you were willing to go through the process, because it would be brutal, I would then definitely ask for a cap. And I'm not saying 10 or 20, I'm just saying, I mean, not like the 2 we have and it stays at 2, but something that would not have 15 come. Something that would be 8, 9, whatever, whatever you think this town is that maximum we should have, because it would really going to attract people if we did that. It will attract those vape people to come here, because that's a huge thing to
Yeah,
have
you
that.
need a twofold approach, I see what you mean.
Yeah.
Well, that's why I want to be
So
careful.
you
We
would
don't
hurt the
fix
little
one
guy
problem and
and you
create
give
another
it
one.
some power to someone else. So it's one of those things, you have to think of the consequence when you
You don't want
cause
the
one thing.
walkthroughs, but
And those retailers, they have a lot of loss, I'm sure, and they replaced it with other things, and now to take those things, there is going to be a lot of discussion about that. So I guess tonight really was the discussion of whether the board has a concern about, and at first was to talking about caps. And for me, it's a matter of, we do have problems with the vape stores. They have not delivered the way they should. We probably should be testing them more if we had money to do so. I think having more of those stores, and I won't just say vape, but let's just say over 21 stores. I was hoping that the consideration of a cap, not 3, not 4, not 5, no particular number, but what is your appetite? What's the top of the appetite? Because it could happen. Everybody asks me, isn't there a cap on cosmetologists? No, there's not, but that doesn't hurt people. But, it would be very difficult if we had a street. I mean, the most recent person who was going to open was literally going to open 200 feet from another one. No fear at all, because, hey, Burger King's and McDonald's go together, so let's just roll them up.
Well, that zoning aspect is something that happens across the board. It happens with automotive.
Oh, yeah. But we don't have any say over any of them, nor do we have to regulate any of them. So this is just one thing. If there's no appetite for it, we won't even go for it. The second thing is a whole nother issue, and we might want to discuss that some more. So if there's no, this was just a kind of a hash out to see whether or not we wanted to open it up to public discussion. And if there is no appetite for that, then that's okay too.
Well, I think we kicked it around very well, Ron. Thank you for all your information.
You're very welcome.
Whatever.
Thank you, Ron. Is it true, Ron, that I heard that some of the cigarette companies, Marlboro or somebody's looking to get into the marijuana business too?
I've heard that, but I'm not sure. I do know I know that the owner of the manufacturer of Marlboro has I think a 30% interest now in Juul. So, and Juul now has, we heard today, about 70 to 75% of the e-cigarette market. It's just fascinating and alarming.
Well, that can only increase that.
Yeah, we're doing the fee schedule over, and that would be my last thing, is you had given me the list of all the fees in the area, and I will share that with you. So when we're talking about the fees of what other are charging, that's another way of, making sure that maybe we can do, I don't know if there's a way we can take fees to add to more inspections or anything like that, but that's a discussion you were thinking of having with the town manager or something at one point.
Well, you know what the thing with the fees is? People shift that very quickly to an illegal tax.
But not if you share it,
No,
without,
well, that's
that's
the
the
whole-
purpose of it.
That's the whole thing. I mean, you know, but you know what the first line of defense is, that that's just a tax on me, it's an illegal tax, and,
But what may happen is, as we know, Ron is not a guarantee either. So even what he's able to do minimally is difficult enough as it is. So just a thought that a discussion is coming up, and we may need to consider having more inspections if we're going by someone, you or other private entity, if we're going to have more.
Do you have a copy of the checklist that you look for when you go into the stores?
I don't inspect them, generally. We don't inspect.
I'm sorry if I was, I hope that I provided you with good information, and I know what I've said isn't definitive, but I think those studies I did send you in regard to the cap are solid, peer review research studies. So they just don't have as much the quick impact. Nevertheless, they have a significant impact because youth are regarded as being much more susceptible to tobacco advertising. And we all do know that tobacco is not hidden. It's up front and center, along with the other things that are in front of the counter, such so.
But
Candy.
if I can just summarize what I think I took away from this, make sure my fellow board members heard the same thing. What I was hearing from you was that if our goal is to reduce youth access to tobacco or vaping products, a cap is probably not the best way to do that, but rather shift where those products are sold or available.
I'm almost in complete agreement with what you said, except I maybe just change it to the movement, the venue by which the tobacco or vapes, I should say the vapes are sold, has a much more immediate impact, whereas the permit cap is more gradual in nature.
Right, which may not ever impact anything if no one else decides to come in and open up shop.
Correct.
So it's more for that rainy day down the road, which may or may not happen.
Well, when I say down the road, I mean what the cap does and what the pharmacy ban does now and what the 500-foot buffer zone does is it's chipping away at the normalization of the normalization of tobacco sales to make it not part and parcel of what is easily accessible. A number of them should not proliferate, but again,
I'm going to say that I think it comes down to a quality of life issue when you start talking about numbers and separation, and I don't see anything wrong with that at all. Numbers and separation from a standpoint of quality of life is a pretty reasonable set-off, as opposed to a cap. Listen, there's only so much room, and there's only so much room you're going to be able to squeeze things in. And you can't pile them on top of each other and expect any kind of quality of life, because just you can look around at other communities and see what's happened. So boards getting together and collaborating on how to make this work is the best way to do it. It shouldn't be the last resort, it should be the first resort. A collaboration on quality of life and what do you want in your town? Well, listen, we just got rid of plastic bags. It's a quality of life issue, And you know what? It maybe takes the community getting together and looking at what their quality level they want to be at and what they won't drop or tolerate or go below. So I think those things are something that should be explored, not just from a Board of Health standpoint.
All right, well, your stamina is admired, so I don't know what time it is, but I think it's late. Thank you very much.
I don't think we need to talk about body art. Although Nathan said, great idea.
All right. What's that?
I said, I don't think we need to talk about caps on body art then.
No.
See if you got that. I haven't had a chance to look at it, just shot up the name.
But Nathan smiled when I told him. He thought it was a great idea.
Let me send it to you right now.
So I think we will,
Susan, we're not going to discuss the body art permit cap?
I just said to him, I'm gathering there's no need to discuss that, so but that's up to you guys.
I'm going to move
What I'm
that
understanding.
I'm going to move that we suspend any more cap talk this evening and refer it to our next meeting.
Yeah.
Yeah, then we can do that.
Yep.
Maybe my last words, I say I'm not for a cap. I'll just leave it at that.
So let's slide into grease trap update.
Oh, geez, let's not.
No.
That's a bad joke.
Go right ahead.
Check it out, Ron, let me know, email me back.
I think I'm all set with the grease trap. Things are moving that well. I only have a few things to wrap up. There's a number of people I'm working with. There's only one person, one group that didn't do anything but engage someone, and but I'm going to make sure that it gets done. So I had spoken to Ray earlier today, and the goal is to get it done. The goal is not to penalize and punish, and so it's going to everyone has agreed that it's going to get done this year.
How do you feel that the policy's working?
This particular, the whole in general, the people who have done the hard work and put the money in have also basically kind of recommitted to the community. They're renovating, they're adding, they're improving, their establishments. They're thinking about expanding, so they're projecting where they're going. So it's really, in a strange way, getting them to really refocus.
It's a long-term investment.
It was holding them back.
Big money, it's big money to do this, so to do it, they really have to. And it's getting people to look at finding safety problems. People who are now putting in these grease traps, they're bringing the line from the restaurant into there, or they're finding, terrible safety problems on how they've been not cleaning as much as they should, in the hood area. Yeah, they do up here and they do back here, but they don't do down here. So there's been a more focus on we need to really make sure we do this annually, as far as, getting under there, putting things on quick disconnect. So they're not happy to spend the money, of course.
So they have to spend money to make money,
But they all know that it has to be done this year. And we haven't had, obviously, since you've given us the latitude to determine the low generator versus, that would have been a whole different conversation, because I would have had people like Rod and Gun back, and that type of thing. And what I've done is created a form that identifies each one of them as who they are, if they're a low generator or not. And during the inspections, we're going to discuss it with them. We're going to do the check-off of all the appliances they have, everything they do, what their current is, and they're going to say, this is how it is now. This is no guarantee. If you make changes, you will be subject to this.
Not only changes, is it if you make an inspection and you find out that what they represented it to be is not
Sure,
what?
yeah.
That's with anything, any misrepresentation, obviously is going to revoke your privilege.
But
Immediate, my question is, and I do get that we're talking about an immediate revocation, though? If it's...
No, I'm talking about immediately ordered to put in the tank, that type of thing. So they would be...
Immediate compliance.
Compliance,
Okay,
because we're giving
immediate
them
So if that happens, they have to go to immediate
this
compliance.
middle ground where
Right,
we
okay.
agree you are a
That's
low
fine.
generator. But I'm going to make sure it's in writing. I'm going to make sure someone there responsible signs for that. So that in the future, when it's not me, and someone comes in and says, well, why this variance, why that?
You're not going anywhere soon, right?
No. There is only the one thing I talked to Charlie about, there's a couple that have undersized tanks. And I asked the opinion whether the undersized tanks, if they can prove by an inspection that they're in good condition, and I mean there's only a couple. do they need to come and ask for a variance through the variance process to get that approval to continue using that? And I think the answer was yes. Is that the answer?
I'd be against the variance process, but I would be okay for a grandfather phase-out process.
Yeah.
So you're grandfathered, but
If it-
you're gonna have to come into compliance within X number of whatever.
Makes sense.
Well, we've already given them 5 years, so what, so is it a time, I don't think it's a time thing, it's a
Capacity.
integrity, it's an integrity
Yeah,
thing.
but when you're talking a couple of
There's
establishments.
literally, yeah, one is tying into sewer, and he has an undersized tank. If that tank passes an inspection, that I've created an inspection form, if that passes, the code still says undersized doesn't meet compliance. So the question is, do they need to come and get a variance for that? Or am I able to say that?
Well, a variance from what? A variance from bringing it into compliance?
Because our minimum was the 1,500, and it says in there, undersized tanks do not.
Well, you understand what the variance is.
So-
That's manifest injustice. It's an impossible standard. And I'll tell you, to be honest with you, a variance requires you to consider all the particular facts. So can they get it out of the ground? Can they comply by putting a larger tank in? It's so fact-driven.
It's so easy, you just crush it and put another one in and you meet it.
It seems to
So-
me that that's,
So, yeah.
if you can meet that, you don't have manifest injustice, so you can't get a variance.
So the question is, then the other question is it, well, you suggested a time, I mean, to grant the grandfather until it fails.
That you would not get, once you have a fail situation or a no pass situation, you need to comply.
Right.
But if you can grandfather it until such time that the current establishment.
If there's a change in ownership, I think there'd be a number of reasons that you could probably
So I could-
grandfather it up until a point, until a contingency happens.
Failure or
What is
change of
the,
ownership.
they have it in, and what is the rationale for why they can't do it?
Oh, that's the whole thing.
Yeah.
They don't want to do it. It's not that they can't do
I
it.
figured that, I
Right, so
figured
it's-
that.
So if the answer is there's no variance,
Well,
there
there's
is no
no
variance.
variance.
But
There's no, that variance process is something that varies the terms of our bylaw.
Right.
It's not something that is designed to.
Very difficult.
To be granted without demonstrating manifest injustice, and that is just a tough one to reach.
Charlie, 1,500 pound, that's cleaned out every
Gallon,
90
yeah.
days, correct?
Well, every 3 months,
they're supposed to be.
Yeah, no longer than 3 months.
unless the effective volume of the grease is 25% of the component.
Should be more.
Whichever comes sooner.
How is that
So
determined?
Theoretically, a smaller component in the same, in a typical use would need to be cleaned more.
Right, that's what I was getting at. So
Theoretically,
Is it
depending on
cost?
how it's,
Yeah, there's a.
but
there's-
is 1,000 small, is
That would
1,000
be-
small? We don't
that
really
would
have a
be-
scientific,
Well, don't they have a baseline of the frequency of cleanings and where it is?
Or what I was considering a variance, but that would be one of the conditions of when you do the inspection, it's undersized. It's not, it's structurally in place, it's H20, whatever.
the one that I'm actually speaking of is 38. 38 Cafe has a 1,000 and has had one for a long time. So that's the one that is going to have to get a letter that says you have to crush your 1,000 and put in a 1,500. That's what would happen. Now, this one is going to be tying in, they're going to be working on it. It's one thing. That's Dandelions. So he's tying into sewer, he's currently on septic, he's tying in. So it would be a matter of crushing the tanks and putting a new tank. The other one would be literally they're already ripping up their, driveway, their parking lot. But the other one, it's a matter of, it's in use, he's not doing any current, they're not doing any current, work.
What is the,
letter is-
what would you consider them as a generator? High, medium, or low?
Which one?
They are breakfast brunch only now.
So they're,
There's no, I don't think they're even using their fryer now.
so I think they're probably a low generator, right?
38. In the scheme of things,
Well, they're open
They're-
7 days a week.
I guess it's the
on that,
equipment they
They're still open
have.
7 days a week, and
They're
it's
open
got,
7
it's a
days,
whole,
but-
it-
Yeah, 7
and it
days.
is, it's a wavy line, yes. Comparatively, that would be also saying then Bradstreet shouldn't be required either. Right, so, and we've already set that standard, the bread.
Yeah.
Well, I have an early day tomorrow. We closing in on this?
So I get,
Yeah,
I'm
So
going to sleep. That's what-
I just need to direct whether this person, if they do an inspection, it's a good integrity, can I grandfather them till it doesn't work anymore? That's my only
Grandfather with
question.
Can you get a
conditions.
frequency of how often it has been cleaned? And like
Yep.
Charlie was
Well, They've
saying,
been on septic right now, so, I don't,
well, I mean, what,
they should still have that.
well, if it's smaller,
They should
the
have
yeah, they should have that in the frequency.
Plus,
and
they're
with-
seasonal, too. They're just, say, closed for the season. They only open 5 months?
For breakfast and lunch?
No, the other,
No.
Oh, yeah, yeah.
Dandelions.
Yes, that much.
You get me on that, too.
Yeah.
Well, it would seem to me that,
That,
it
yeah,
would seem to me that this is a case-by-case basis issue, number one.
but not a variance.
No, definitely.
And number two, it would seem to me that reporting in the forms are going to become important to make a determination as to what remedial necessities are going to be made. And three, I mean, let's look at the practicality of it. If their business were to increase or their operations were to increase, there'd be no question of what they have to do, right? The basis of the grandfather is the operation is not changing at all. It's seasonal in one case, and it's,
A footprint in another case.
yeah, exactly. So the authority you're looking for really is to maintain the status quo.
But what's the baseline status quo?
Right.
It exists.
But we haven't done the inspection yet, so we don't even know
We don't
what
even
its
know if it's
condition
compliant.
is. It-
But
it
wouldn't you
could
think that
fail
one of the
on-
reasons, one of the conditions necessary is that we have an inspection report and we understand what's in the ground and how it's operating?
That's-
Because if you're looking for status quo, I think we need that information in order to make an informed decision.
That's part of the regulation.
That's
in the
part of our
regulation.
question, yeah.
Has anybody that's looking at that defaulted in providing that information, or?
We only started
Not
really
volunteered
requiring
then.
it this year, so I know they would have submitted it this year, but I can ask him for, back as much as possible.
I would think that might be something you want to do.
Two entirely different situations, but they happen to have one similarity, so I was just kind of looking for,
So is the question before us whether we extend the director's authority to hold the status quo?
or do I just enforce?
There
Period.
is, well, there are no.
That's the question.
Well, what's on the table right now is there are no we're not going to issue variances.
Absolutely not.
So
so we
that's
need to
done.
extend her,
So we need to give
And
her
make a
the
motion?
authority to,
Maintain the status quo
Based-
with the
Conditions.
Conditions.
conditions based on
Okay.
professional
evidence.
Well, we have
assessment.
a fairly straightforward standard that we're having everyone meet. I don't think there's any questions that you can condition it under those standards.
Sounds good.
And I don't think there's any question that you would be the person to make a quick determination that it's a risk.
Got it. Thank you.
Done.
well, we have to do it as a formal,
We do have to do it formally, so from a standpoint of making a motion, to extend authority to make
To the director.
a status quo determination and place conditions to maintain the status quo to the director on a case-by-case basis. And
Based on
because
documents.
of the low number of these types of situations,
It's
it would seem to me that the basis of that would be she, more than anyone, would be able to keep a closer eye on the situation for public health. And my
Yeah.
motion would be to extend that authority.
Okay, motion's been put forth to extend the authority. Anyone willing to second the motion?
I'll second it based on documentation established what the status quo is, or facts, findings of fact.
I think we incorporated that in the original one.
Okay.
Okay, motion's been put forth and seconded. All those willing to approve signify by saying aye.
Aye.
Chair votes aye as well. Motion carries unanimously 4-0.
Thank you. Otherwise, it's going pretty well.
Are we done with the cookies?
No, it's half of one lot.
And then you had
It's better than scallops.
fees,
No, absolutely not.
which we can push off to next month.
Yeah, definitely.
Been long enough tonight.
Yep.
So, Mr. Rue, this is your opportunity.
Well, I just want to make a comment before I do that. I was approached by a person that knew I was on the Board of Health with just a question about the runoff problems that exist in the springtime when these golf courses open with insecticides, herbicides, and whatnot, realizing that when you start traveling up the Merrimack River from here, you got Trellbrook, you've got the Long Meadow in the valley, you got the Tingsboro Country Club, you got Vespa, you've got Sky, there's so many of these things. They were asking me, what is the impact of the runoff going into our
But
water?
they're all supposed to have what's known as best management practices, points of release. All of those things are supposedly controlled under the Wetland Protection Act as they are abutters to a resource area. So,
So my answer is, don't worry about it.
well, that jurisdiction lies with DEP.
Okay.
It lies with the local towns that have bylaws regulating runoff or the Wetland Protection Act.
The
So
concern was that's our water supply, and what was up, and I said, I really don't know. I said, I can put it out.
most best management
systems should be
practices are
monitored.
supposed to be in place.
Okay.
There may
And I'm
be
assuming
answers.
water quality sampling is
They're
part of it.
sampling, right, they're monitoring.
Yes, it is. But
Because that's the definitive way.
DEP responsibility to provide protection to that issue, that springtime issue.
Well, pests, fertilizer and all that, right? It falls under just a different.
They're not supposed to be using high nitrogen
Right,
fertilizers. They're
so-
supposed to be using as many organics as they can.
'Cause they're-
I think, but again, I'm sure that there are people out there that are non-compliant, but that's up to the Conservation Commission to determine whether or not they violated.
Well, the person that asked me has some experience in that whole landscaping around, and he started talking about that Roundup stuff, and I went, look.
Well, that's because they have a lot of advertisements on the news now for the glycophosphate that was put in that supposedly is carcinogenic.
I don't
I
want.
will ask Stefania if she knows, if there's anyone who does any studies on the
All right,
Merrimack for you.
I just wanted to,
Yeah,
I told them
no,
I'd
yeah.
bring it up. I don't know the answer, but I'll tell them.
She'd ask me
Valid,
something
it's a
and
good
I ask
point.
her
I-
something.
I-
so
I'll
that's what
tell
we
them
do.
that we did.
So we
It was a
work
good,
together.
it was,
Mr. Chairman, I'd like to make a motion
What time is it?
9:30.
that we close the meeting so I can go home and eat.
Yes.
Been eating all night.
Anyone willing to second the motion, please?
well, second.
I'll say,
Okay, motion's been put forth and second to end tonight's meeting. All those in favor? Aye. Chair votes aye as well. Good night, Tewksbury. It's 9:30 at night.